ano na lang ang itakbo punta lang lang sa one. Alam mo, sa mga pang-daily, ano, saan pa ang source po after
Webinar.
So, tayo mismo, sa menu natin may
Diyos, alam. Mga prof doon eh. Diba doon kilala na din naman ni Manny?
Ako na pa ako eh, gumawa ka ng letter of seniority. Nandun sa ako. Wala ang daw clerkship.
Oh, talaga.
Oh, pero okay lang. At least nakilala ko.
Tapos sa amin noon, kapag pero kami account kasi acquaintance
Ano
party.
ba kasi
So,
mga
acquaintance. Pag
Mayroon sa London.
Ha?
Mayroon sa London.
Live yan na.
Hindi? Wala. Live.
It was Zoom.
don't have any actual experience per se, but I just recently won the Black versus Red Challenge at Shire. No big deal, except for the criteria experience. My section has been very key to my progress in time. This is a very nice setup.
Nak, paano yung voice volume ko, nak? Ako na ba? Ako na lang.
Ilang live pa na? May 10. Iba ko? Paano po? Huwag na
na lang yung channel ko sa.
Kindly mute yourselves po.
Sakayin na lang ng sampo mo. Kaya mo na.
Sabihin ko kasi na ano si Dakondo.
Meron na skip.
Ay,
Hello, good morning. Narinig po ako. So good morning po sa lahat. While waiting for the
Yes,
speaker,
sir.
po, we'll just wait for a little while. Ma'am Cherry, narinig po ba ako ng mabuti? Kasi
Yes,
nasa pharmacy
you
ako.
are audible. You're audible. But I suggest you come here at the MCC
Yung power-
conference.
Bakit? Mas malakas ba internet dyan?
Yes, there's an yes.
Sige, lipat na lang ako, madam.
Better. Thank you. To all the participants, kindly wait for a while so that the other 200 registrants in the Zoom for this webinar
Ano, hindi mo na tinuloy yung sinabi mo.
Wait lang, na-distract kasi ako. Ang dami pa nagpapa-admit. Wait lang. Okay, sorry. So please, to all the participants, kindly wait. For now, let's watch the video, the promotional video of the SIMC and the other promotional videos given by the WHO. Thank you. Okay. Sorry. Sorry naman. No. Ay. Ako yung controller eh. Ito na lang, ako na lang.
Ma'am Cherry, wala pa si Sir Melvin, no?
Wait. I'll update you in a few. Wait lang po. Ako na, yan ang project. Pero how can I be?
Yung madam ko, hindi na kami. Yung link na kay Ma'am Terry. Meron sa email.
Hello, good morning to our dear participants. While waiting for the other participants to enter the Zoom platform, kindly watch the video that will be shared on your screen. Thank you very much.
Alcohol spray, brother.
Lang ako, sino bang nakaupo dyan?
Ano ba yan? Huwag ka mo nang manood ka. Ito nga kaya ako dinalato, hindi naman kita makakonect sa wifi. Kaya, ito yung patient thing. Sabi rin sa akin Meron na.
Mga simpleng pangako na masisiguro ang kaligtasan ng pasyente. Ako ay nangangako na pauunlarin ko ang aking kaalaman at kasanayan upang magbigay ng mas ligtas na pangangalaga sa aking mga pasyente. Ako ay nangangako sa pagiging aktibo na makilahok sa aking sariling pangangalaga. Ako ay nangangako na bago ibigay ang gamot ay aalamin ko muna kung para saan ito. I-check kung tama ang pasyente, gamot, paraan ng pagbibigay o pag-inom, dosage at oras ng pagbibigay. Ako ay nangangako na magtatanong sa pasyente kung naiintindihan niya ang aking mga payo tungkol sa ligtas na paggamot. Nangangako kaming magtutulungan bilang isang koponan na bukas at malinaw. Nangangako akong ipaliwanag sa aking pasyente kung paano gamitin ng tama ang kanilang mga gamot. Nangangako akong susundin ang kinakailangang pamamaraan para sa bawat panganganak at operasyon ng aming pasyente. Nangangako akong ipagpapatuloy na bumuo ng mabuting pakikipag-ugnayan sa pagitan ng pamilya, ng pasyente, mga tagapag-alaga at mga profesional sa kalusugan. Nangangako ako na patuloy na mag-aalaga at magpapagaling ng may sakit batay sa ebidensya ng pananaliksik at siyensya. Nangangako ako na mapapanatili ang pagpapatuloy ng pangangalaga ng mga pasyente. Nangangako ako sa patuloy na pagtatag ng kultura ng kaligtasan ng pasyente. Nangangako kami sa pagtiyak ng kaligtasan ng bawat pasyente dito sa ospital. Makilahok, makiisa at magsalita, kaligtasan ng ating pasyente pahalagahan. Magkakasama tayong makakapagligtas ng mga buhay.
Igo.
Ayan na.
Kasama ko. Sa tawa ka man tayo ni namin. Bakit kung kasali din? Hindi naman tayo. Hindi naman.
Hello, good morning once again to everyone. In 5 minutes, we will start the webinar.
One good deed can change everything. Let us take the patient safety pledge of the Southern Isabela Medical Center. On this day, I, Dr. Melchor C. De La Cruz Jr., Medical Center Chief of the Southern Isabela Medical Center, do hereby promise to actively participate in pioneering a new standard of care through nothing less than complete, system-wide, transformational change. To always do all that is in my power and never underestimate the power of my own.
Nothing less than complete, system-wide, transformational change.
To always do all that is in my power and never underestimate the power of my all.
To change this to a place of safety.
By first safely creating a place of change.
To beg, borrow, and emulate ideas from others who got it right.
And to share, promote, and report on errors so others don't get it wrong.
We are not afraid to openly communicate, point out mistakes.
And put this is how it's always been done in its proper place. I to contribute to a community.
Of problem solvers,
Getting safety down to a science. Getting safety down to a culture.
a systematized checklist of always events, activities, records, never events.
I promise to have faith in prophecy of my experiences.
And believe in the power of prevention in each case.
To remember that, because I am human enough to err.
I will be human enough to care. That I will not accidentally be the source of the scar, I swear.
I promise to do what I love and love what I do.
To proudly demonstrate my love affair with health care.
By always adding a bit of treat to everyone's treatment.
Not as a provider, as a person. Not for patient, for a person.
I do hereby always remember that I am not in a healthy.
I am in the human business, that we are each human beings.
With a joining breast and tangential flesh, common breath, and inevitable breath. Trying to find our harmony in someone's songs. To solve this problem of a life well lived, and then share it with the guests.
Basta magpa-deliver.
Alin?
Hindi daw siya. Deliver.
Hello, good morning everyone. Hello, good morning everyone. Good morning to all the 138 participants for the second day of the Medication Safety Webinar Series with the theme Medication Without Harm. So for now, let's begin our webinar since there are already 138 participants. Just a reminder to all our dear participants, please mute yourselves. Please mute your mic.
Sound speed is very low.
Very low.
How low?
How low? Please ensure that you have a good internet connection.
And your volume is at max na lang.
Yes.
At magdala ka sa iba. Okay.
Am I audible? Hello, good morning.
Ito may light. Mr. Clifford.
Hello, Sir Clifford. Good morning.
Morning, ma'am.
Sorry. Narinig po ba ako?
Yes, ma'am. Okay naman,
Thank you,
ma'am.
Sir
Clear naman po.
Clifford.
Yes, ma'am.
To all our dear participants from SIMC, good morning, and to all our external participants from other agencies like the Philippine Nurses Association and the Academe, ISU, and ULS, as well as other LG hospitals in the province, as well as private hospitals in the city. Good morning. So welcome again to the second day Medication Safety Webinar Series in line with the Patient Safety Week celebration of Southern Isabela Medical Center. This seminar is organized to convene for medication safety. According to ASHE, safe medication practices begin with placing medication safety as an organizational and departmental priority and implementing a system that will support these practices. To begin this webinar, let's begin it with a prayer.
Our Heavenly Father, the fount of all goodness and grace, the cause of wisdom, the source of intelligence, we welcome you, O Lord, to this auspicious gathering of your beloved, who continuously give you thanks for every opportunity to learn something new and become fruitful to the works of your creation. We humbly come to you, not because we are worthy, but because we find ourselves in need of you, who is our strength and our hope, to continue despite the challenges we face in health, prosperity, and our solidarity with one another. We pray that today's gathering, made possible by the grace of advancements in technology and social media, become successful in its endeavors, so we can offer it back to you as our humble offering to honor you, glorify you, and love you through our deeper connection with everyone. May we find bliss in today's session and become more productive children and co-creators of the earth. This we ask and pray through Christ our Lord. Amen.
Sorry, B.
Good morning, everyone. To our members, to the members of the Patient Safety Committee, and of course, the members of the Management Committee, Dr. Butch Garcia, to Ma'am Jennifer Manuel, our ever supportive Chief Nurse, and also Attorney Mahal, FMO, and Ma'am Ajo, Chief Administrative Officer. Good morning to everyone. I am Cherry Lu, the Patient Safety Focal Person of SIMC. I am your host today. So let's proceed now to our webinar. Again, reminders to all the participants, please check your microphone. Please mute yourselves upon entering the platform. Thank you very much. The Philippine National Anthem.
Mga kababayan, ang pambansang awit ng Pilipinas.
Hanap ng puso sa likod ay lupagilingan. Hiling ko lang magiging kakamay ito. Tadagatan.
Pero is like something nagkakasunod ba? Alag ng puso.
Again, good morning everyone and welcome to the second day of the medication safety webinar in line with the patient safety celebration. Again, good morning everyone, and just a reminder to all the participants and to give respect to all the professionals here in the Zoom webinar. Please mute your microphone. And if you want to speak, we will give you a chance during the Q&A. So again, good morning. To begin with, for this webinar series, to give her welcome remarks to all the participants, may I now call on our Chief Nurse, Ma'am Jennifer S. Manuel. Good morning po.
Morning.
Sorry. Stop sharing. Ma'am Jen, good morning.
Ako ba?
Okay, dito na lang siya.
Ito na siya. Our guest speaker, Dr. Melvin Miranda, President of the Philippine Nurses Association. Dear colleagues, ladies and gentlemen, good morning. It is my pleasure in welcoming all of you to the Medication Safety Webinar Series Day 2. The global campaign reiterates the objectives of the World Health Organization Global Patient Safety Challenge, Medication Without Harm, launched by WHO in 2017. The campaign calls on stakeholders to prioritize and take early action in key areas associated with significant patient harm due to unsafe medication practices. This includes high-risk situations, transitions of care, polypharmacy, concurrent use of multiple medications, and look-alike, sound-alike medication. The campaign will provide a special focus on the implications of the COVID-19 pandemic for medication safety, considering the serious disruption in the provision of health services. For today's seminar, medication administration safety, monitoring in medication use and management, and importance of validation will be discussed. This session is an investment that helps to improve our knowledge and attitude on patient safety. This can help in achieving the objectives of World Patient Safety Day 2022, which includes raise global awareness of the high burden of medication-related harm due to medication errors and unsafe practices, and advocate urgent action to improve medication safety. Engage key stakeholders and partners in the efforts to prevent medication errors and reduce medication-related harm. Empower patients and families to be actively involved in the safe use of medication, and scale up implementation of the WHO Global Patient Safety Challenge, Medication Without Harm. Before we begin this seminar, I would like to express my heartfelt gratitude to all of you who sincerely committed to this event to make it a success. This event would have been impossible without support of each and everyone. Thank you, and let's inspire each other towards patient safety.
Thank you very much, Ma'am Jen, for your welcome remarks. Indeed, everyone is committed, everyone is challenged to scale up medication safety. Please allow me to share my screen again. To give may I now call on our amazing chairperson, Doc Luella Tan, for her message.
Hello, hello, hello. Am I loud and clear? Morning to all of you. Esteemed guest lecturer, Mr. Melvin Miranda, President of the Philippine Nurses Association, homegrown lecturers, Dr. Stephen Ray Pontanillan and Athena Bernice Carlos, partners in healthcare and the academe, masters of ceremony, colleagues from the Southern Isabela Medical Center led by our MANCOM, Petro, Public Health Unit, Department Chairman, and training officers, unit heads, welcome to each and every one of you. Today, on the second day of our webinar series, we will recognize the nurse's role in medication safety, as every nurse administers an average of 10 doses of medicine for every hospital patient every day. And according to estimates published last April 2015 in the Nursing Journal, 1 to 2% of hospitalized patients are harmed from medication errors, resulting in an increased length of hospital stay from 4 days up to 10 days. Medication administration errors are underestimated and underreported. Explanations for underreporting include a lack of awareness that a medication error has occurred, unfamiliarity with medication administration error reporting processes, fear of legal ramifications, and fear of being perceived as about half of nurses are reticent about reporting medication errors because they fear disciplinary action. A stigma is associated with making an error, and nurses perceive they will be a target for repercussions if they admit to their mistakes. And to make matters worse, the error could have a negative impact on the nurse's performance evaluation. Our nurses must recognize their own roles in medication errors to begin with by willingly reporting errors that have occurred in order to improve practice and ensure a safe patient care environment. In addition, the nurses' knowledge on pharmacology, integrating pharmacokinetics and pharmacodynamic principles into clinical practice is essential for patient safety. Understanding the onset, peak, and duration of medication effects encourages timely medication administration and helps prevent the possible accumulation of adverse reactions. So this is the period when our pharmacists enter the picture, assuming the 8 essential medication-related responsibilities linked to improving patient safety. And what are these? Our pharmacists must ensure access to medication, supply medication information, evaluate medication appropriateness, improve medication adherence, review a patient medication regimen to ensure that drugs work well together, determine current patient status, and also medication effectiveness. Before I end my speech, allow me to express my utmost gratitude to the growing number of participants from our institution and from other hospitals. And to name a few, we have Callang General Hospital, Quirino Provincial Medical Center, University of La Salette, and also Isabela State University. It is our hope as a small committee to create networks of change in our region, Cagayan Valley, sharing this platform in the interest of patient safety. Thank you and welcome once again.
Hello, thank you very much, Doc Luella, for that amazing opening remarks. So to again, wait lang. Wait lang. To give his inspirational message of Dr. Melchor C. de la Cruz, Medical Center Chief of Southern Isabela Medical Center.
To our distinguished speaker, Mr. Melvin Miranda, President of the Philippine Nurses Association, to our very own clinical pharmacists, Mr. Stephen Ray Fontanilla and Miss Athena Vernice Carlos, to our beloved nurses, fellow physicians, pharmacists, members of the expanded management committee, to all participants from the Philippine Nurses Association, universities and hospitals in Isabela, good morning. Patient safety is fundamental to quality health and nursing care. The International Council of Nurses believes that the enhancement of patient safety involves a wide range of actions, performance improvement, environment, safety, and risk management, including including infection.
Sorry, I have to interrupt the other participants. Again, please place your microphone, mute your microphone, please. Okay, let's proceed for the inspirational message of our Medical Center Chief, Dr. Melchor C. De la Cruz.
To our distinguished speaker, Mr. Melvin Miranda, President of the Philippine Nurses Association, to our very own clinical pharmacists, Mr. Stephen Ray Fontanilla and Miss Athena Vernice Carlos, to our beloved nurses, fellow physicians, pharmacists, members of the expanded Management Committee, to all participants from the Philippine Nurses Association, universities and hospitals in Isabela, good morning. Patient safety is fundamental to quality health and nursing care. The International Council of Nurses believes that the enhancement of patient safety involves a wide range of actions in the performance improvement, environment, safety, and risk management, including infection control, safe use of medicines, equipment safety, safe clinical practice, and safe environment of care. In line with our Patient Safety Week celebration with the theme Medication Safety, the message it conveys highlights the critical role of our nurses. According to studies, every nurse administers an average of 10 medication doses for every hospital patient per day. Nurses need to recognize the challenges they face when administering medications to their patients. Since nurses consistently administer medications, they are well positioned to prevent medication errors. They have to ensure that the 14 rights of medication are met in every medication administration among all patients. To all dear nurses, may you all be inspired to integrate best practices for medication safety, especially on the importance of monitoring and validation. As Sarah Kay says, an American poet, practice does not make perfect. Practice makes permanent. Repeat the same mistakes over and over, and you don't get any closer to any goal. Thus, let's strive to practice the best practices. Thank you, and my snappiest salute to all the nurses.
Thank you very much to our dear MCC. To give the introduction to our guest speaker, may I now call on Ma'am Cleo S. Labios, RNDPA, Nurse 6, our Assistant Chief Nurse.
Blessed good morning, everyone. It is a great pleasure for me to introduce our distinguished keynote speaker and a leadership icon who is going to talk about medication administration safety. Being in nursing education for almost 20 years, it has been the commitment of the esteemed resource speaker to continue the legacy of the founders of his alma mater. He is the present Dean of the College of Nursing in Manila Central University since 2013, where he also earned his Bachelor of Science in Nursing degree and Master of Arts in Nursing, major in Administration and Supervision. Continuing in the professional advancement, he had completed major courses in the Doctor of Philosophy in Nursing Education, major in Leadership and Management in St. Paul University, Manila. Prior to his shift in academia, he had been appointed as chief nurse and consultant of VA Hospital Incorporation in May Kawayan, Bulacan, that honed his administrative and leadership skills. soaring greater heights on active involvement in professional organizations, being elected as national president in 2022 and treasurer 2021, Executive Committee of the Philippine Nurses Association Incorporation, and as a Board of Governor of PNA National Capital Region Zone 2. It further opened opportunities in October 2021 as the elected NOMELEC of the Association of Deans of Philippine Colleges of Nursing Incorporation, ADPCN. He continued his professional involvement as founding officer and treasurer of Association of Men in Nursing of the Philippines, AMNP, in 2020 up to present. On April 9, 2022, he was elected as Board of Trustee under the Council of Professional Health Association, COPA, of the Philippine Federation of Professional Associations, PFPA. Geared towards his advocacy on evidence-based practice, he was appointed consensus panel member of the Department of Health and the Institute of Clinical Epidemiology of the UP Manila National Institute of Health that initiated the updating of the 2004 Clinical Practice Guidelines on Periodic Health Examination, and currently representing the accredited professional organization as a member of the Professional Regulation Commission Career Progression and Specialization Program and Credit Accumulation and Transfer System. And now, ladies and gentlemen, please join me in welcoming Dr. Melvin Miranda. Let us give him a big round of applause.
Thank you very much for that warm introduction, and as well as to the invitation of the Southern Isabela Medical Center, to our administrators and officials of the Southern Isabela Medical Center, to our nurses, who are very dedicated and very committed to the profession in medication safety, and as well as with the patient safety. Good morning to everyone. We in the Philippine Nurses Association, good morning. We in the Philippine Nurses Association, as well as with the various healthcare institutions, geared towards our commitment when it comes to patient safety, and as well as on how we will be engaged as an advocate in patient safety. It is very important for all of us to take into consideration that our role with the recognition as key player of the universal healthcare, we must possess the necessary skills, knowledge, and attitude as what we have been oriented during our college education. So I really admired that every institution, such as the Southern Isabela Medical Center, are continuously advocating the World Health Organization when it comes to patient safety. Before I start, let me be allowed to share my screen. Okay, just for a while, I'm just looking for my presentation. Before I open up with my presentation, it is indeed very important for all of us to have our mindset to consider that our core beneficiary of care is really the patient, and the highest priority when it comes to our engagement with our professional responsibility is definitely patient safety. So that's why most of the initiatives of the healthcare institutions geared towards in this perspective. So I'll just share. So may I be allowed by the host to share my screen for the projection of the PowerPoint? So still disabled. So while waiting for me to be allowed to share my PowerPoint presentation, let's just go back to our perspective of why until this time from the college education until this time, whenever for those nurses who are already in the nursing administration and management level, we still consider our monitoring because there are still medication errors that have been identified and reported. And most of our...
Sir.
Yes, ma'am.
Ma'am, sir, you can now allow to share your screen. Kindly check
Thank you.
po.
Yeah, thank you so much.
Welcome po.
Ayan. Thank you so much. Thank you very much, ma'am. So again,
Welcome, sir.
thank you. So again, thank you very much to the Patient Safety Committee of the Southern Isabela Medical Center. It is very much an honor and privilege to be invited because as what I have mentioned, I've been through also with my clinical practice. Now, since I am engaged into the nursing education, it is also very important for me to really have the necessary knowledge, skills, and attitude, because in the academe, we are preparing our future professionals. And indeed, we always inculcate to them that the highest priority is really patient safety. And one of the responsibilities wherein it will really manifest the performance when it comes to advocacy of patient safety is on the medication administration. So this morning, welcome to our Medication Safety Webinar Series Day 2. And the topic that was assigned to me is on the medication safety. And we could say that this could be basic, but until this time, it is considered as one of the challenges. Moreover, for those situations wherein unexpected circumstances happen. So it is, as what I have mentioned, it is a matter of mindset that you really need to be focused on how to really manage sometimes concerns when it comes to medication safety. But again, it's also part of our indicators when it comes to quality is not to commit errors with our patients, because any minimal errors that we do to our patients may take risk basically on safety. So as a disclaimer, as what I have mentioned, as mentioned po, that yours truly is the National President of the Philippine Nurses Association, and I'm the Dean of the Manila Central University College of Nursing. So most of the information that I will be presenting this morning is gathered from the reputable sources. So as we start with our webinar this morning, I will just play an audiovisual presentation so that as we move on with our discussion, we could relate on how we will really take into consideration the 3 R's. Okay, what are these 3 R's? The 3 R's is, the first R is realization. You tend to realize your roles as very important when it comes to medication safety. After this discussion, the realization that you will really need to contribute to your colleagues as mentors, because the value of mentorship will really engage everyone on how we will grow professionally and even personally. The other R is referring to reinvention. You need to be innovative nowadays when it comes to the acquisition of the knowledge, skills, and attitude. It will not just only isolate and confine all that you have learned during your college education. With the continuous growth, we need to be updated on the trends when it comes to the medication safety. And there are evolution when it comes to these principles, because every now and then we encounter new drugs and medication in the market. There are new ways on how we will promote safety. So I think the reinvention is very important. And the last R that we will consider is reformation. Hoping the outcomes of this webinar may translate into the perspective of a policy or enhancement of policies, or if you have existing policies, hoping this webinar, this discussion of medication safety may help each one of us on how we will contribute when it comes to institutional policies, but not just only in the institutional level, but probably in the national level. So we'll start with the audiovisual presentation, and it goes like this.
Welcome to SingHealth, Thank you for choosing SingHealth as your healthcare provider. While we take precautions to provide a safe environment for you during your admission, you'll need to listen closely to our nurses to understand and ensure that you're not only given the correct medication, but that you consume it properly as well. We encourage all patients to bring their current medication or at least a detailed list and show them to us. This way, our staff can check what medication you are on so we can adjust it according to your condition and new treatment plan. This is very important as we need to know if you have any allergies or if there are certain medications you require. It's very important not to take your own pills while staying with us before discussing with your care team. Let us help you adjust your medication according to your treatment. Once we understand and make a note of your medication, you'll be able to keep it at home. Before we can give you your updated medication, we'll need to ask you for your full name and identification number to verify your identity. We appreciate your patience during this time, as it is crucial for your safety that the right medication is given to the right patient. Please do not disturb the nurse while she is administering medication to another patient. Your nurse needs to concentrate during this time. If you need assistance, simply use your call bell and another staff member will be with you shortly. To help you take care of yourself when you return home, we may ask you to start using certain types of medication on your own while you're still admitted. These will help you get used to these types of medicine on your own. Way, if you experience any side effects such as unusual rashes or itch on your face or body, constipation, diarrhea, dizziness, drowsiness, headache, insomnia, or any other symptoms. They could be signs of a bad reaction to the drug. Please also let us know if you have any other concerns to the drug that you are taking. We hope this video has helped you understand the importance of medication safety and consumption at the hospital. Together, we can make the hospital a safe and comfortable place for all patients. Thank you for watching.
As an advocate of healthcare, it is indeed very important. It is indeed very important for all of us to take into consideration our roles as nurses. Okay, then it is not just a role by which we can do it alone, and to have holistic approach to our patients. This will consider also collaboration with other healthcare personnel of the hospital or any healthcare setting. With our situation when it comes to medication safety, we may not just only consider our role within the hospital, because since we have been oriented with the different phases of healthcare delivery system, with the promotion, prevention, curative, and rehabilitative, we start our role even with our own families. So that's why when it comes to the setting wherein we could consider medication safety, it starts usually with the community. And if ever on the promoted preventive, it may not be managed, then that's the time that it may lead to the referral to the hospital and admission. And if cases may arise, or rather if the case may arise that it can't be manageable to the certain hospital, then this could probably may lead to the transfer of other areas or transfer to the other hospital. And once the patient may lead to the recovery, then the patient will be discharged. On this basis of the healthcare delivery system, we take into consideration that once the patient have been admitted into the hospital, it is very important to take into consideration the discharge planning. The discharge planning are merely considered when the patient is already admitted in the hospital, because it is very important that during the time of the hospitalization, we take into account on how the patient will be considered with high independence when it comes to medication safety. However, when the patient goes home, when it comes to his take-home meds or medication, the independence that you have promoted, that you have taught, that you have shared to these patients will bring impact on how it will also promote safety among themselves without the presence of the healthcare practitioners or personnel. So that's why with the discharge planning, it always indicate or consider the what we call medication regimen. And who will take part when it comes to the discharge stitching? The nurses. The nurses are the ones who will take part when it comes to these major responsibilities. So with some of the problems when it comes to the medication discrepancies in the community, usually the most who are affected when it comes to the medication safety is there are 14 to 98% community dwelling older personnel, and even 27 to 57% of residential aged care facilities or home care had medication discrepancies. Actually, this must take into consideration of the situation now, because we have some healthcare facilities that have not been regulated with some of the agencies, and seemingly the guidelines are not strictly implemented. So chances that medication errors are highly prevalent. On this situation, it may also take part when it comes to the inspection and monitoring of these facilities in the community, even though these are on the palliative care, or even though we are taking care of the older patients. Older persons are the ones who may have high vulnerability when it comes to medication errors. Why? Because they may need assistance. They may have concerns when it comes to the physiologic perspective of how they comprehend when it comes to instruction, and how they understand specific instruction to promote safety among themselves. So that's why there's a need for assistance. But for those situations that there are some healthcare personnel who may not be updated with necessary and expected skills when it comes to medication, this is basically the problem. Because whenever we give medications to older persons, they need to understand what we are doing to them, because this is basically to
Double
establish
purpose
rapport.
equipment.
The second concern is merely on the perspective on how the uh, the nurses will take part on the safety of older persons. So physiologically, the pharmacokinetics, the pharmacodynamics, and pharmacotherapeutics may vary when it comes to the population group, specifically the older persons, because we are aware physiologically that their metabolic activity are slower rather than to other population groups. So we need to consider on how it will really promote effectiveness and effectiveness of these medications to our patients. So that's why the basic knowledge in pharmacology, such as pharmacokinetics, is very important. If we will try to go back in our pharmacology, that in the pharmacokinetics, we need to understand the ADME. It is on how the drugs will be absorbed, distribute, metabolize, and even excrete. So this ADME, absorption, distribution, metabolism, and excretion is very important for us, simply because it is directly associated with the concentration level and with the pace or time on how the drug is taking effect into the body. And once this will consider already the physiologic changes and the chemical changes within the body, then that comes in the what we call pharmacodynamics. And in every drug that we give, we must also be knowledgeable and have the mastery on the pharmacotherapeutics, because in this perspective, we need to be an expert actually, because patient safety is really a high consideration. When it comes to pharmacotherapeutics, we must be also knowledgeable, skilled, and have the expected competencies when it comes to the desired effect of the drug. So it may not just only consider that a medication will be given to the patient, but it is on how you will connect definitely with the patient for them to also have the independence when it comes to protecting themselves with the medication safety. Within the hospital admissions, with this survey, 3 to 97% adult patient, 22 to 72% pediatric patients had at least one medication discrepancy at admission. So from this study in the hospital admission, most of the medication discrepancy that have been accounted through this study is from the perspective of dosage. Okay, the dosage is the one that had been accounted that really caused the what we call medication discrepancy. Actually, among the healthcare personnel, nurses are the ones who are really focused. Focus driven tayo with our responsibilities. So that's why we always manage our anxieties. We always manage every time that we are under pressure. We are poised under pressure because we need to be focused. That's why every time that we do preparation of medication, computation of medication, it matters. But based from the study, this is one that will really need to focus among these areas. These usually have been considered, the results have been considered. Transfer within the hospital, 62% had at least one unintended medication discrepancy at transfer between units in hospital, which is, for example, if it is from the ward to the critical care units or special areas, and from the special areas to the ward or to the ambulatory care services. So with this 62%, the one unintentional medication discrepancy are usually identified from the transition of shifting from IV medications to oral medications. So this has been accounted. So we must also be keen and be careful also on this perspective, because there are some situations that in any responsibilities of medication safety, it was accounted that there is one unintentional. Probably this could lead to a very simple situation that the drug had been given with loading dose, specifically with the computed loading dose. Upon discharge, 25 to 80% of patients had at least one medication discrepancy upon discharge. Usually, it was accounted here that the discrepancy of medication is related to the proper discharge teaching. Even though it is written, okay, it is written, there are some concerns that really have been considered as a problem when it comes to the level of understanding of the patients and proper instruction. So that's why it is very important, hoping here in the Philippines, once a patient have been discharged, if we have a follow-up, consultation with doctors, why not have also a trend to have a follow-up consultation also with nurses? Because we all know for a fact that we have been with the bedside with our patients, and we all know what happened with our patients when it comes to their medication response or with the physiologic response of every individual or every patient when it comes to medications. So these are the data, which is basically from studies that cause the what we call medication discrepancy. So let us now proceed with the framework on how the medication error is happening with some of the facilities. These are the indicators wherein the framework that we have considered when it comes to medication error. So somehow with the factors that have been considered are the following. So we have the drug selection and procurement. We all know that there are certain guidelines that we are considering with formularies, and when it comes to the drug selection and procurement. However, within the process, it is very important for us. That's why we consider this is definitely medication safety is a collaboration. This must also take into consideration how the doctors, the pharmacists, the nurses will take part when it comes to the medication safety. We have been immersed as nurses, we have been immersed in this responsibility, but we must not only consider this as our routine responsibility, but also our accountability. So that's why from prescribing, dispensing, and drug administration, it is very important for us to really consider nursing process, because it is a way on how we will decide accordingly if the drug is safe for our patient. Because even with the basic with the vital signs that we will retrieve and we will record, this will have an implication on the patient safety. And you can decide by yourselves. You may not have the decision of the doctors per se, but the nurses may decide accordingly to withhold the drug if we think that this will cause harm to our patient. And that's the time the collaboration comes in, when we will refer this to our doctors or the attending physician. So that's why there are situations also that the nurse must also know the medication history of the client, because it is very important that upon prescription, as we collaborate with the attending physician, we must have the proper coordination and communication in terms of how we will promote safety to our patient. And in any situation, adverse reaction will really consider a higher level of life-threatening condition, and it may cause danger to the patient. If it may lead to the toxic effect of the drug. And if it may lead to the toxic effect of the drug, then this could cause a possibility that may lead to the multiple organ dysfunction. Because we all know that in the process, the drugs may basically affect the processes when it comes to the circulatory, we have the liver and we have the kidneys, which most of the drugs are nephrotoxic and most of the drugs are identified as hepatotoxic. But merely this could be prevented if we are aware. But when it comes to the preparation and dispensing, we are already knowledgeable when it comes to how this has been stored, how this could lead to a safe preparation and definitely distribution to the healthcare units. Most of the hospitals now, we are doing our functional roles because of the situation of the number of patients. The functional method, when it comes to the perspective, like I will be the medication nurse for the day. There are some situations that the nurse will take charge of all the responsibilities of the holistic care of the patient, including the medication administration. But for those areas who are utilizing this way of the functional method when it comes to the management of functions, make sure that the proper coordination must be practiced in all areas with all of the healthcare team, specifically with the nurses in the unit, so that nurses conference must be also considered as the best practice, because somehow there are some situations, because of the number of patients that we are catering within the ward, there are some situations that the nurse who is assigned to those particular patients will do the endorsement to the next shift nurse. But the other nurse the other nurse in the unit may have their separate endorsement because they have been assigned into the other patients. It is very important to have a consideration that the endorsement must be with the nurses in the units, from the outgoing to the incoming. I know this has been a practice in almost all of the hospitals, because we must take the benefit of why we do this. Because when it comes to the preparation and dispensing, the proper endorsement when it comes to the status, the storage of the drugs that we are preparing, and at the same time the experiences that you have considered with the patient when administering the drug, is very important to endorse to the other shift. So this processes is very important when it comes to medication safety, and this comes the what we call drug administration. Review of drugs that had been administered and order is very important, simply because in nursing process there is a continuous monitoring of the patient, because there are some medications that are being administered continuously, even through the use of the intravenous pump. It is through the piggyback. So there could be possibilities upon continuous monitoring of the client, specifically with the use of the vital signs. We can withhold the drug. We can put on hold the continuous medication administration, simply because we have identified and assessed some reasons, probably justifiable reasons, for us to withhold the drug. This is on how it will bring high confidence for the nurses to really promote medication safety, because we withhold the drug because it is basically, we have identified it could be an adverse reactions that may lead to the toxic effect of the drug. Because we must be agile in this perspective, because it may lead to life-threatening and danger and may cause harm to the client. So what could be the expected output with these processes of medication safety. We can assess the drug response of patient, report patient reactions, and error occurrence. We are aware of the pharmacovigilance, right? The pharmacovigilance have been emphasized even during the situations on the rollout of the vaccination, and nurses took part in this situation. Even also in the hospital, we must have also the pharmacovigilance committee for us to have the proper reporting and the proper interventions that may enhance guidelines on how to attend to these situations. This will also prepare our our entry-level nurses to take part when it comes to their professional growth. Because for those who are in the administrative level, nurses, you need to do mentorship. And through the results of these processes, they could be guided when it comes to the priority of patient safety. So this could be indicator framework of the medication error. Very basic, but any little error, little and minimal error will cause a possibility of the safety of the client. Now, when it comes to the situation of a survey of what are those common errors that have been accounted. So the highest is use of the what we call inappropriate schedule of product administration. So meaning the drug administration is the one. Because it is very important, go back to the concept when it comes to the medication safety. Yung maximum concentration level and the time is associated with the result of the drugs you are administering to your client. Be knowledgeable about the what we call peak concentration level. Be knowledgeable of what half-life is, because this will guide us that the proper scheduling, the proper timing and frequency of giving the drug itself matters, because it will affect the half-life of the drug. So this basic knowledge may significantly be directed to our objective if we will meet the desired effect of the drug. Sometimes there are some excuses, but excuses in terms of I did not manage to give it to the proper time because of the load or the patient load that I have when it comes to the medication. Almost the drugs that I will administer for this morning is 8 a.m. That is very realistic, but take into consideration, put it in the mindset. It is very important that the appropriate schedule of drug administration is very important, because again, as what I have mentioned, this is basically connected and aligned of what we call pharmacokinetics. And in the pharmacokinetics, we're considering the peak concentration level and the pace, the time itself, that will really identify that we are on the standard way of administering the drug. So these are some concerns that have been identified, because we are aware of the generic names, we are aware of the brand names, because let's face it, some of our doctors may definitely have this brand, because by review of the literature, this could be most appropriate for the condition of the client. So, but there are some situations like, doc, this brand is not available. Can we shift to a generic or to the other brand? So, yung concern with that is that we must take into consideration the generic name itself may have the same or similar indication with the desired effect. However, the brand name have been identified simply because this may possibly differ based from the drug literature or evidences that they may that they may disseminate to us when it comes to the efficiency and effectiveness of this drug. So with these errors, we must also be mindful on how we discharge our performance when it comes to medication, because there are still concerns related to overdose, and there are some also a consideration when it comes to administration error. And usually, when we talk about these concerns, we take into consideration the pathway. Okay, the pathway on how we will strategize specifically our situation in the organization when it comes to medication safety. Let us put into perspective that from the administration level down to our staff, it is very important that the medication safety is clear. Okay, is clear when it comes to its guidelines. So that's why in the phases of high level strategy, we must have to revisit some of the concerns. That's why post-conference, pre-conference and post-conference within the unit is very important, so that also on the middle manager level, they could also understand how they can strategize and assist for professional growth when it comes to the responsibilities in medication safety. And on the level of the management, it will be on the decision on how they will enhance the institutional guidelines. That's why we need to put into context that the management have also rather a major responsibility when it comes to this: the organization, the safety agenda, and the clinical negligence. So how it will consider yung mga provoking conditions. So these are the common factors that have been identified when it comes to the medication safety. Training and experiences. So hoping most of the establishment, and I know the Southern Isabela Medical Center with the advocacy on the patient safety, have the continuous engagement when it comes to continuing professional education. But this is somehow a concern with other hospitals. So hoping the other hospitals may also take part when it comes to these best practices that you have in Southern Isabela Medical Center. As also for those who are in the academe, our major role is to really consider the standards when it comes to medication safety to our students. And the clinical instructors are the experienced nurses who can share eventually those situations that may really consider patient safety or medication safety. So these are concerns. Even poor communication. Poor communication is one. That's why before, during my time of practice, I will not anymore go back to the years, but I'm 1997 I'm 1997 graduate, and as I practice in the clinical, specifically in the hospital, these are one concern that really bothered me when it comes to the communication, because we are receiving telephone orders, we are receiving verbal orders. So that's why you really need to be focused when it comes to this, because anytime with the right documentation, any minimal error in the documentation that you may have may take risk the patient. So that's why during the time the telephone orders, the verbal orders were minimized, because this could be the source of problems with the medication error. So it needed to the translation of the institutional policies. So we all know for a fact that there are some situations that will really consider yung tinatawag nating culture. Kung for example, if this has not been a practice with the other ward, we must also take into consideration that there must be an institutional culture. And who will definitely take part on this culture on medication safety? It's the institution. So that's why the unsafe acts may lead to the possible concerns when it comes to negligence, when it comes to the practices which is not acceptable when it comes to the safety. Any errors kasi, and even minimal errors will be alarming to all of us. It's a major responsibility, lalo na in medication. So that's why even the Center for Disease Control in the United States, they are having the promotion when it comes to how to promote medication safety. They are usually recommending ml in the prescription, because this could be one way that will standardize on how they will prevent medication errors. This campaign on the medication safety through the CDC had been effective because it undergone the specific evidence-based analysis, and at the same time, these are the product of the recommendation of the results of the research according to the CDC. Now, since we are also an advocate of the medication without harm, okay, by the World Health Organization, these are the 5 moments of medication safety. When you try to reflect, I have mentioned about the 3 R's, right? You have the realization, we have the invention, and we have the reformation. I will now connect it with these 5 moments for medication safety. As you start doing your medication, okay, you must always start with the use of the principles of nursing process. And as you administer this medication, it is very important to go back naman to the basic concept of the pharmacokinetics, which is the absorption, distribution, metabolism, and the excretion. Upon adding a medication, you have to consider the continuous monitoring of the patient and assessment. And upon reviewing the medication, that is now considering if there are adverse reactions or if the patient is experiencing side effects. We all know that there are some side effects which may cause discomfort to our clients, but let us take into account, nurses, that health education is very important for the patient to understand that these are side effects. And you need also to provide education when it comes to their safety, because there are some side effects, such as, for example, when the patient is receiving a vasodilator, usually the side effects that the patient may experience is headache, dizziness. So do we have a concern there with the safety? Yes. With the dizziness and the headache, the patient may experience injury during the time of yung experience nila with the side effect. So it is very important to consider the monitoring and at the same time the health education and awareness of the patient for them also to have the independence when it comes to medication safety. And if ever there are some adverse reactions that will be observed and be recorded, then stopping the medication is the one that will consider safety. So these are the 5 moments of medication. It is indeed very important for medication safety. The goal of the medication safety is number 1, from the studies and researches, always consider a problem with medication errors. However, it is one thing that we could resolve on this is instilling best practice habits to our nurses. The third that we can consider in the goal of the medication safety is for the nursing service department and for the institution to have the continuity when it comes to the professional growth on the advocacy of medication safety administration. And the number 4 of the goal of the medication safety, don't ever have hesitancies and even reluctancies to share your acquired knowledge and skills to those nurses on the entry level. It is a way of mentorship. Mentorship is very important when it comes to medication safety. Even though for the entry level, you will still be supervised by your superior because we have the accountability. And this working relationship when it comes to the promotion of medication safety is very important. However, with these medication errors that are happening, the high cost of medical errors, usually these are almost, even in the United States, why it's costly? Because yun nga, most of the medication errors have been translated into cases. So very particular ang United States when it comes to medication errors. And nowadays, we are integrating technology. So that's why with the use of the hospital information system, we need to take into account the monitoring as well of the institution to continuously have some research or means that if on the shifting to hospital information system or through the use of the hospital information system will affect, or there are factors that will affect the medication safety. So let's go back again to the 3 R's. We must have the realization, because if there are reports, then we must do the reinvention and do the innovation, reformation, and we do the guidelines that will really help the institution as well as with our nurses. Now, on the perspective on the different steps to prevent medication error. So very basic ito in the Fundamentals of Nursing 9th edition, but we have already the updated edition of the Pater and Perry. I know nurses, you're very familiar with the Pater and Perry Fundamentals of Nursing. These are the emphasis. These are the emphasis of the Fundamentals of Nursing by Pater and Perry. Prepare medication for only 1 patient at a time because we need to focus. Every single dose that we compute matters. Okay? Follow the 6 rights of medication administration. But here in the Philippines, I think as mentioned, it was already 14. I think in some institutions it's already 15. Even though if it will be 20, it means that even in the increasing number of the rights of medication, meaning we are very now sensitive when it comes to safety. Sensitive meaning we are prioritizing safety. That's why we have now 14 rights of medication, 18 rights of medication, 20 rights of medication. Even if it reached 25 rights of medication, the common denominator is still safety. So read each label 3 times, okay? Use at least 2 patient identifiers. So meaning, as we are nurses, we are aware that the most and the highest priority when we give the administration of medication is to identify the right patient. But we must also take into consideration to have to identify I know this is nurses are focused when it comes to their responsibility. And the other one is provide proper patient education. The Teach Me 3. Always follow agency policy. So sabi ni Pater and Terry, if you will notice, it starts from the individual responsibility and end up with the responsibility of the institution when it comes to medication safety. And what will be the role of the Philippine Nurses Association? The Philippine Nurses Association will take part on our advocacy to help the institution have a joint collaboration to promote the advocacy of medication safety. And it is very important, very basic, but very the highest importance and significance are very counted. So the 6 rights before are being emphasized by the CDC: the right medication, the right dose, the right patient, the right route, the right time, and the right documentation. These are the 6 very important among the 14, among the 10, among the 20, the very important rights of medication. Nurses, probably you may be aware of the right medication. You can identify the right dose, you can compute the right patient, you can identify the right route, you are aware of the enteral and parenteral. The right time, you are aware of the frequency. And the right documentation, you have your medication sheet. Okay. Will this orientation be sufficient for you to promote medication safety? Because these rights of medication must take into account if you are aligned with the standards and guidelines. And even though we have the evidence-based practice, or EBP, evidence-based nursing practice, put also into the perspective that the evidence-based practice can also really help in the clinical decision making. So that's why we emphasize, and I may not anymore elaborate on the rights of medication, but however, basic but very important. Now, when it comes to the responsibilities, there are some hospitals and there are some institutions with nursing affiliates, meaning we have students. So that's why it is very important that the collaboration when it comes to the medication, we must immerse already our students when it comes to the medication safety. We are promoting the medication safety among our staff. We must also promote medication safety among our nursing students, because whenever they will be immersed in their practicum, in their internship within the hospital, they are part of the system. They are part of the system because we have the memorandum of agreement with the higher education institution and with the facility. So meaning every nursing student who comes in the hospital will really take part also on the process, and medication safety must be emphasized to them. So that's why orientation of our nursing students is very important, because there are some situations that happened before and cases before that a nursing student administered a high dose of potassium, and it was not supervised by the clinical instructor. So I think there is an accountability on that perspective, because it must emphasize the implementation of the provisions of the memorandum of agreement. So that's why if we do orientation on our nurses and we advocate medication safety, we must also have these measures for our nursing students to even realize until at this time of their practicum and internship that the medication safety is very important, regardless of the patient condition, regardless of the alert level of the patients, regardless of the levels of care that is necessary for the patient. What matters most is in all population groups in all healthcare settings, we always prioritize medication safety. And how you will be guided according it? With the 14 rights of medication that you have, even in the Southern Isabela Medical Center. And the patient safety committee is the one that will really help, the committee that will really who will really help our nurses and our healthcare personnel to really comply and conform with these standards. However, these are in the prevention of errors, these are some tips that we could use or guide that we could use. I know your patient safety committee have their own guidelines and forms that are being used, but we must take into consideration. That's why we have been oriented nurses, why we do drug study during our college education. It is simply for us to be immersed on the basic knowledge about the drug. So why we need to know the side effect, why we need to differentiate it with the adverse reactions. It's still safety. So there are some situations also when it comes to the pharmacodynamics, yung mechanism of action of the drug, that there are some drugs or medication that may not be mixed with other drug. There are drugs that may not be mixed with other food because it can counteract its effect. So these are very important these are very important situations and factors to consider, because if you will not lead to the desired effect, then you must realize what are the factors that will contradict its effect, that will counteract, not contradict, that will counteract its effect. So it lies on the hands of the nurses who are on the bedside care and in collaboration with the team. Wherever, if there is an error or there are errors that may happen, we must take into account in the medication safety. I know the patient safety committee knows this. There must be complete proper agency documentation, appropriate patient assessment when the patient encounters drug reaction or on the part of our healthcare personnel who administer the drug, because we need to balance on how we will still consider the patient safety as a priority. Notify the clinical education manager. Not all hospitals do have clinical education manager, but this could be an option that the clinical education manager could be helpful when it comes to the staff development and when it comes to the interventional management of the concerns that may happen related to medication. So complete UDM medication variance form, so the one that I have presented in the previous slide. But I know that there are some forms, this may depend on the institutional policies. So on the perspective scenario, something to think about. There are situations that you're unprepared, overconfident, and high anxiety. Who will take part of the responsibility? Yourselves. But this must be with the help of your nurse managers. It is a collective effort. It's a joint effort. So that's why the nurse managers must be also have the responsibility to continuously mentor their colleagues, their subordinates as well. On this perspective, the medication without harm of the World Health Organization will really guide us. Patient and the public, healthcare professionals, medicine, systems and practices of medications, high-risk situations. So that's why this guide of medication without harm for the global patient safety challenges, the World Health Organization are reminding all of us, they are always reminding all of us that patient safety will not just end into policies. It must definitely imbibe with our own selves to practice it with discipline. Now, when it comes to the integration of the patients, families, leaders, policymakers, the action plan, the safety action plan is very important on the national level, on the institutional level, because this will have the continuum of care and continuum of implementation of medication safety. So in the Philippine Nurses Association, we could have the joint collaboration when it comes to this perspective. And soon we could also ask World Health Organization, if the Philippine Nurses Association, if your institution, your patient safety committee will have a joint initiative that will promote medication safety. And this could be possible. And indeed, with this webinar series of Day 2, Medication Safety, hoping that I have shared my experiences with the 3 R's that I have mentioned as our learning outcomes. Realization. The realization that we are contributing to the safety of our clients as our highest priority. Reinvention, because we need to be innovative in a way on how we will adapt to the updates and trends in medication safety. And reformation. We must be catalyst and agent of change so that to promote medication safety. Again, good morning to everyone and God bless.
Wow, thank you very much, Sir Melvin, for that very comprehensive and educational, inspiring. Lahat na po yata ng positive na adjective pwede ko nang sabihin, sir. So, thank you very much, sir, for that very inspiring medication safety lecture focusing on safe medication practices po. So at this juncture, it's time for the open forum, sir. Our clinical pharmacist, sir, Doc Ray and Doc Athena is requesting if you can stay until the end.
Yes, definitely. Yes.
Sige po. They are here with us in the conference po. So among the participants, the floor is now open for the open forum. Anyone from the participants who have questions, you can type in the chat box, or you can open your camera to deliver deliver your question.
Or it could not be, or probably if it is not a question, probably they could share best practice because this is a learning session. So you can also share experiences as well, ma'am.
Okay. Yes, that's right.
May isang open forum naman. Open forum naman.
Okay, anyone to encourage other participants to share, I would like to give a synthesis on what Sir Melvin Miranda has shared to us. He mentioned the word mindset, and this mindset is really the concept of his mindset on patient safety is really inspiring. The words in the lecture of Sir Melvin is really inspiring for all the nurses here working in the hospital, especially during pandemic. And what catches my attention is his words regarding the routine responsibility. Nurses should not consider medication safety as a routine responsibility. Rather, it is an accountability. And the 3 R's. Okay, Sir Melvin, meron po may tanong po. We have one question. Does a nurse always have to follow a doctor's order?
Okay, with that question, actually, with our independent function and with our clinical decision making,
exactly,
our competencies, our acquired skills, knowledge, and attitude will be sufficient for us to have our own clinical decision making. That's why we are walang hierarchy in the healthcare team. We are members of the healthcare team. So that's why coordination yung culture that must manifest in the culture, what you call this, coordination and collaboration must manifest when it comes to the healthcare team. So being a member of the healthcare team, it will always take into consideration the right clinical decision making that I may do as a nurse. If, for example, assess, that's why with the principle of the nursing process, and we all know that we are very particular with the background, with the historical background ng kanilang medical history, medication history, because those foundation or information that is necessary prior to administration of a certain drug that had been prescribed by the doctor will give us also a separate entity to decide by ourselves If, for example, we will suggest to the doctors, Doc, I withhold the drug because I have the vital signs recorded as this. Doc, I withhold the drug because I have the pertinent records that identifies that the patient have allergies on this chemical component of the drug. So I think those are a manifestation of high independence when it comes to the competencies of nurses in clinical practice.
Okay, so I believe Sir Melvin has answered it well. The question was answered. So an additional question coming from Sir Dexter Ko, a nurse from Diverse Medical Center. May I ask, sir, how often we consider patient equity concerning medication safety, especially having a ratio of one nurse is to 10 patients? Thank you.
Okay. So actually, when it comes to the patient equity, we are considering on how we will manage our time, on how we will manage our responsibility. Already on how we manage it accordingly. Since we are bounded with the standards and guidelines, we are aware on how to manage the time so that even though with the ratio of one nurse is to patient, we still consider the rights of medication that we are bounded to do so that to promote the medication safety. So concerning the patient equity, this could be a factor, but it could be prevented. Okay, so through the specific standards and guidelines that we must do, and sabi ko nga po, it must definitely with these institutional guidelines, with the ward guidelines and policies that we have, it must be seriously be practiced with the discipline of nurses. And who will benefit? Our patients. Thank you.
Thank you much, sir. Additional question from Ma'am Cristina Duarte from City Ilagan Medical Center. What would you share as best practices of medication safety in a unit that caters more than the ideal ratio of 1:40 nurse-patient ratio? Because most of the government hospital in the province are understaffed.
Okay, so actually one of the programs that I have encountered in some of the hospitals, although this could be limited for the government healthcare institution because it will require plantilla. For the private health sectors, healthcare facilities or sectors, they are now having the training for clinical pharmacists. So for every ward, there is an assigned clinical pharmacist that will be in close coordination with the staff nurse, because with our responsibilities from the preparation phase, from the dispensing up to the administration, it will really take part on our responsibility. But who will be the one who can monitor and be with you to monitor? If it's possible, if you could have clinical pharmacists in wards, if that is possible, but I know it will take a lot of processes when it comes to plantilla to government healthcare institutions, but for some private healthcare institutions, they are already doing this, having clinical pharmacists in wards. Thank you.
Hey, thank you very much, Sir Melvin. Any more questions? Any more questions? Okay, one more. Okay, from Eurice May David. May I ask po if how can a pull-out nurse as a medication nurse can prevent committing medication errors, reality-based, pull-out nurse cannot join proper endorsement at ward or other areas.
Okay. If we say pull-out nurse, if for example, I think this is referring to if we have insufficient number of staff in the ward, sometimes some nurses from other areas will be pulled out. Is this the setup that we're considering? They have been pulled out from other areas to support the additional manpower to that specific area, probably on situations like if there are staff who are absent, so they will be pulled out. Is that the setting that we're considering?
Yes, sir.
If that is, yeah, thank you. If that is the case, I agree with you. Na if, for example, you have been pulled out again, you have been pulled out, and you have not witnessed the endorsement. You have not been involved in the endorsement, then I know that even though you are an experienced nurse, you must put in your are bounded with the pharmacokinetics. Okay, I need to prepare these medications because I need to administer this drug on the right time. But what situations like that you will be hesitant because you don't have the medical background or profile of the patients whom you will administer or will be given who will be given the task to administer the medication. So one thing that is very important is that of if, for example, if within the shift, it will always have a collaborative effort and collective effort of doing responsibilities. So if you are a pull out nurse as a medication nurse, it is very important that when you do the medication administration, you must also be with someone who is also in the ward.
Exactly.
Because it's a shared responsibility. It must be a shared responsibility. Because I do understand yung situation that you have been pulled out, tapos you may have this anxiety. Okay, how can I administer this drug with confidence? The confidence that we are looking at is I do not have any background of the patient. I can have my clinical decision to withhold the drug compared to a nurse who have attended and have been involved with the endorsement. So since this is a shared responsibility, there must be someone who is in the ward, who is a ward staff, who will be with you in the administration of this medication. So I think that is one that will really consider medication safety. Thank you.
Okay. Sir Melvin, your wisdom on medication safety is really inspiring. The
Thank
word
you.
that really catches our attention is the word mentorship, collaboration, coordination with one another. It is true that once a pull-out nurse is assigned to a different ward, there should be a senior who will monitor him or her or the staff in the area. Okay? So, any more? Okay, additional, last na po to. Last question from Sir Peter Tom. Sir Melvin, among the ways of ensuring safe medication preparation and administration, what for you is the most effective method to reduce medication errors? Kindly elaborate, sir. Thank you.
Yeah. Prevention of medication error is the timely reporting. Yan. The timely reporting. If you will have hesitancy to report it, every minute that the patient have adverse reactions, every minute the patient will be at risk, at high risk, will lead to life-threatening conditions, and it will danger the life of the patient. So we must, as what I have mentioned, the accountability and responsibility on this matter is timely reporting. Another is one of the best practices that I have mentioned also, if it's possible, to have a regular medication safety what do you call this? Medication safety sessions. Yung the ward, the staff ward staff or area staff may have a session that will just talk about some of the with that concern. This may be translated, or if it will be with the superior, this could enhance a specific policy that will be very beneficial not only for the nurses but also to the patients. So two things to take into consideration. So number one is to really imbibe the discipline and have the medication safety standards be implemented to our patient. The second is the post or the pre or the post conference that will involve our nurses to resolve and have a unified insights to translate this into policies. And policies will definitely guide us on how we will promote medication safety. Maraming salamat.
Wow, that's a gold answer, sir. Thank you very much for your wisdom. Thank you, sir, for sharing your knowledge on best medication safety practices. In addition to what you have said a while ago, Sir Melvin, about timely reporting, it's really to promote that kind of timely reporting. Our nurse managers also should promote a safe workplace where everyone can express their feelings, their sentiments, as well as saying their mistakes without the fear of punishment. So again, Sir Melvin, at this moment, we would like to award a certificate of recognition to our esteemed guest speaker. So please allow me to share my screen. Okay, so allow me to read the certificate of appreciation is awarded to Sir Melvin Miranda, RN Man, for being the esteemed guest speaker with the topic Medication Administration Safety during the Medication Safety Webinar Series held on September 14, 2022 as part of the institution's Patient Safety Week celebration with the theme Medication Without Harm, given this 14th day of September on the year of our Lord 2022. Signed, Dr. Luella M. Tan, Patient Safety Unit Chairperson, Butch Loreto O. Garcia III, MD, MBA, FIX, Chief Medical Professional Staff, and our dear Medical Center Chief, Melchor C. De La Cruz, Jr. Thank you very much, Sir Melvin Miranda, for your sharing of your wisdom and knowledge.
Thank you so much. My privilege at your service.
Thank you po. So moving forward to our next speaker. Allow me again to share my screen. Okay. Our guest speaker is a patient safety advocate since day one. Currently, he is a core member of the institution's Antimicrobial Stewardship Committee and Medication Safety Program of the Patient Safety Committee. He is also the Hospital Pharmacy Internship Coordinator and Pharmacy Department Training Officer, and also the brainchild or the innovator of the medication safety program here at Southern Isabela Medical Center. On December 2016 to March 2019, he is the pioneer of the institution's Antimicrobial Stewardship Program, core member of the institution's Patient Safety and Infection Prevention Control Committees. He is also previously a member of the Hospital Bids and Awards Committee, a previous member of the hospital's research team, initiated an in-house research on needs assessment of a medication safety program from medication error frequency. Currently, he is taking his master's at De La Salle Medical and Health Sciences Institution for his master in public health. He finished his Doctor of Pharmacy at Central Escolar University, Manila, and finished his Bachelor of Science in pharmacy at the same institution.
Yes, ma'am.
So please help me welcome our guest speaker for this morning on monitoring in medication use and management, Dr. Stephen Ray G. Fontanilla. Yay. Okay.
Ito. Good morning. Hello po. Narinig po ako. Am I audible po?
Yes, sir.
Yeah, okay.
Yes
Thank you
po.
po. Thank you po. May I ask, the ones from University of Lazareth to take a photo dyan po sa audience ninyo. Okay. Hello, Mama. Sorry po. I'll just prepare my slides. I'll open the file na po. Is Sir Melvin still here? Sobrang timely. The topic you presented earlier was so timely. Actually, nabanggit mo na po yung ibang mga sasabihin ko. Ang galing. I hope we realize that medication safety is a domino. Tuloy-tuloy po siya, sunod-sunod po siya. So when one person in the medication use process commits an error, sunod-sunod po siya. It's never a one-man fault or a one-person fault. It will be everyone's fault in the process. I was so amazed na ang dami niyo na ho nabanggit, especially on pharmacokinetics, no. Sana all well-rounded yun, di ba? Sana all lahat po ng nurse process po natin will be well-rounded in terms of medication therapy. But on some concepts po in medication therapy, you leave the interventions to us. So can I just confirm? Ayun, nakikita na po yung slide ko sa monitor. Good morning, everyone. Again, I am Stephen Ray Fontanilla. I am a pharmacist at Southern Isabela Medical Center. Wait lang. These are my. Please, i-mute ko po kayo ha kapag narinig ko po kayo. So, this is my disclosure slide. I was currently the past president of the De La Salle Medical and Health Sciences Institute Student Council. I am a member of the Philippine Pharmacists Association, the Pharmacy Preceptors Guild of the Philippines, a member of the Young Pharmacists Group Philippines and the DOH League of Pharmacies, and I am not receiving any grants from pharma or the tobacco industry currently. Parang yung kay Ma'am China kahapon. Yes. Ginaya ko lang. So yun. I'm currently taking my master in public health, currently in my thesis. To start, question for everyone here in the audience. How do you know if your medication is appropriate for the patient? After ordering the medication, after several days when the medication is ongoing, and when do you say a medication is discontinued, put on hold, shifted, or completed? Malamang po ang sasagutin po ninyo, basta po na-order na ni Doc. I think that's a question, inaasahan ko na pong sagot yan. Basta po nasa order ni Doc. But in monitoring, all of us are involved in seeing our patient, in assessing our patient. hindi lang po si physician ang tumitingin sa kanya. The nurse actually is one of the primary people to witness a patient's response to therapy or non-response. Also, the pharmacist can also be someone who can monitor the patient. So it's always a collaborative effort from the physician, the nurse, and the pharmacist in monitoring your patient. We go back to the medication management process as stated yesterday by Ms. Benosa. So the circle you see is the medication management process adapted from the Joint Commission. We will be focusing on monitoring, yan po, the one in the arrow, monitoring your patient. What happens to the medication and what happens to the patient after the patient has been administered with the medication. So dapat po, kapag na-administer na po yung gamot, alam na po natin yung intended effect niya and how do we know if the patient has been responding well to the medicine or not. So medyo keen eye po dapat tayo dito when monitoring your patient. As Sir Melvin said kanina earlier, monitoring is a continuous activity in medication use. Continuous siya. It doesn't stop in one point or at one point of the medication use process. So questions for policymakers and hospital administrators or for the other hospitals, no? Sino po ang nagmo-monitor sa patient ninyo after they receive a medication? Is it the physician? Is it your nurse? Is it your pharmacist? You can answer po. Sige po. Let's have some survey, no? Ulitin po natin. Who monitors what happens to patients after they receive a medication? Someone answered nurse. Okay, nurse daw. Nurse. Nurse po, nurse. So as I have said earlier, sobrang laki ng involvement and pagiging witness ni nurse sa monitoring or sa pagtingin sa response ni patient. Monitoring in medication use involves watching out for patient's response. Who is laughing? Okay, the ones from NC po, I think. Monitoring in medication use involves watching out for patient's response or non-response to medication therapy. So the failure to monitor your patient failure to monitor your patient may result to in treatment failure or unrecognized ADRs. So ang magiging problem natin dito is, alam po ba natin yung hindi dapat na nangyayari sa patient? So once your medication has been administered, once we know the intended effect, we also should know what is not the intended effect of the medication to the patient. Paano po kung yung patient ninyo hindi naman nagbigay siya ng, for example, potassium chloride oral po oral tablet. Uminom siya ng potassium chloride tablet pero nagsuka siya. So ang tanong doon, sino ang nakakita, di ba? Ang tanong natin dito, who monitors what happens to the patients? Ang tanong, alam ba niya na nakakasuka ang potassium chloride pag ininom niya? Or nakakasakit siya ng tiyan? The bigger question there is, alam mo ba yung dapat mangyayari or mangyayari sa patient mo upon administration of a medication? So failure to monitor that, baka magpanic si nurse. Kung hindi siya aware na nakakasuka po ang KCL na oral, baka magpanic siya na nagsuka yung patient. Dok, nagsuka yung patient. Nasuka yung patient ko, ganyan. But if you know already that potassium chloride is a gastric irritant, alam mo na dapat yung remedy mo or gagawin mo upon taking the medication. For example, also, clindamycin, an antibiotic. Familiar po tayo with clindamycin, no? Clindamycin is taken with a full glass of water. And also, you refrain the patient from lying down after 30 minutes kasi masakit sa tiyan. So pwedeng magsuka din yung patient mo, similar to potassium chloride because clindamycin is a gastric irritant. Kung aware, baka po kasi magreklamo yung patient nyo na kumikirot yung tiyan niya while taking the medication. Hindi mo sinabi. Hindi mo kinounsel. So, it may lead to unrecognized ADRs and may result even to sentinel events. Paano kung hindi natin na-counsel and ang nangyari sa patient, sumakit yung tiyan niya, di ba, dumugo, nagka-stomach ulcer, or worse, nagka-deadly diarrhea. So it may result to a sentinel event once we let them go undetected or even unreported. I very much agree with Sir Melvin's statement kanina na you need to report your medication errors. As Dr. Between and Miss Christine said yesterday, di ba, dapat po nire-report talaga because we want these errors not to happen again in your system. Next slide. So what happens when we failure to monitor our medication effects, di ba? We will lead to medication errors. So a large chunk of medication effects is grounded on pharmacology and therapeutics. So dapat may alam tayo. Kahit man lang yung basic, hindi na necessarily on the molecular level because you leave that to the pharmacist, you leave that to your physician, di ba? But for example, as nurses, no, kahit pa paano alam natin kung para saan siya. Hindi po yung tinanong kung para kanino po, para saan po yung gamot ng ito, tapos ang isasagot niyo po para po sa inyo. So hindi po dapat ganun. So minimum is that we know what the patient what the drug does to your patient, para saan siya. Another monitoring error is the incorrect interpretation of data and the incorrect transcription of laboratory values. So there's your pharmacokinetic data, laboratory data interpretation, and radiologic findings. When do you say that the value is critical? What do you do when you receive a critical value of, example, a laboratory result or a serum concentration? Diba? Who reports this and how is it reported? Sino ang nakakatanggap? Sino ang nakaka-receive? So I hope you have a process for that. You should have a process on reporting critical laboratory or even radiologic findings. Incorrect timing of monitoring. Monitoring values, some monitoring values, for example, INR, need to be monitored critically. May specific time siya. Kasi po, there might be medications that might influence your laboratory results. It may also lead to false positive or false negative results. So if a patient is concomitantly taking medication that can alter laboratory findings, dapat po naka-spaced out siya. And dapat kapag nag-monitor po tayo ng lab values, medyo specific tayo sa hour. That's a reminder for your physicians, for our physicians there. Let's be keen on ordering the monitoring or the laboratory parameters. Also, there's the incorrect timing of serum concentration monitoring. For example, there are drugs that need to be monitored in terms of drug level, like your Vanco, phenytoin, and aminoglycosides. These drugs have quite a narrow therapeutic index, and their pharmacokinetic profile is based on the amount absorbed by the body and the area under the curve. So, for example, po yung vancomycin, minomonitor po actually yung laman niya sa katawan in terms of concentration. Giving vancomycin after administration does not stop its monitoring there. Titingnan niyo pa po kung gaano kataas yung level ng vancomycin sa katawan ng tao after several doses. So ang tawag po doon ay trough levels or peak trough levels. Dapat po meron siyang dose range or may concentration range siya. And dapat po aware po tayo kung kailan siya kukunin. So for example, after 5 doses, after 6 doses, kailangan matimingan din po ni doctor kung kailan alam mong steady state na yung concentration. So you go back to your fundamentals in pharmacokinetics and pharmacology. Ayun, critical values nga, ano. So there should be an alert system on how to report critical values. You see how we involve also nurses and the medical technologists. So they are usually the first people to receive the data. I-communicate po siya ni nurse, di ba, kay physician, or ni medtech kay physician. Ang tanong, how do you communicate these critical values? It's very crucial in patient care to have a policy or urgency in communicating critical value. So dapat po, your critical value should be timely, urgent, and complete. So hindi lang po pwede tayo na mag-picture ng laboratory, then send mo na kay Doc via Viber, send mo na kay Doc via Messenger. Tapos ang sasabihin mo lang wala, sinend mo lang agad. So hindi po ganun ha. Pag nag-send po tayo ng critical value, you tell the doctor of the urgency. And how do you communicate critical values? You use the proper tools. You check back, verify. You can verify, the nurse can verify with the medical technologist, is this a critical value? Yes. Kung dalawa kayo, na-validate nyo, na-double check nyo, you refer to the physician using a proper communication tool. Ulitin ko po, wag nyo lang pong i-send kaagad kay physician yung result. You use your proper communication tool. You use SBAR. You communicate using SBAR, and your SBAR should be timely, urgent, and complete. Kasi po some have told me about their experience on communicating laboratory values, no, or radiologic findings. Pinipicturan lang. Tapos sinesend na over Viber, over Messenger. Kulang yun sa information. What I have also agreed with Sir Melvin's presentation earlier was the patient's role in medication therapy. Kasali po si patient and their carers, yung mga significant others nila, yung mga kamag-anak ko nila, the family members are the primary source of data in monitoring your patient. How do you do this? You interview them. Kausapin niyo sila, pagkwentuhin niyo po sila, make them feel safe with your presence, and ask about their medication therapy. Ano ba ang na-experience nila? Ano bang nararamdaman nila? They are the most valid people to express their the drug's effect, di ba? So we validate the patient's feelings toward the medications being used, especially if it is a new medication added. Sabi nga po kanina, no, dun sa presentation ni Sir Melvin kanina about sa 5 moments of medication safety upon adding a medication, no, we should check if aware ba si patient tungkol dito, ano ba ang nararamdaman ng pasyente tungkol sa bagong gamot niya. So probe if a patient is complaining of an untoward or a strange effect after medication administration. So the knowledge on side effects and adverse effects come into play. How do you know if an effect on the patient is a side effect versus an adverse effect? It's both terms are different. So dapat ma-delineate mo siya between a side effect and an adverse effect. We go to ADRs, no, adverse drug reactions. Nabanggit po, natutuwa talaga ako na nabanggit siya ni Sir Melvin kasi I realized na how continuous the process is. And yun nga, nabanggit ko rin dito, babanggitin ko rin dito. So ADRs. So what classifies as an ADR? Di ba? It's a noxious unintended reaction in usual normal doses. Who detects the ADR? Sino nagsasabi na ADR siya? Sino nakakakita ng ADR? Most likely, yung side effect, nakakita ng side effect rin. It may be the nurse or the carer of the patient. Or pwedeng the patient himself. Then who reports the ADR? Is it the nurse? Is it the doctor? Is it the pharmacist? Is it the Pharmacy and Therapeutics Committee? Is it the medical director? Di ba? Itatago na lang ba natin yung ADR? ADRs are not medication errors. Hindi po siya mali, di ba? It's an unintended response of the patient. How is an adverse drug managed or treated? So you reverse the effect, di ba? does your institution, does your hospital have a policy or process in handling ADRs? So, may nagko-collect po ba? May nag-a-analyze ba? Kasi on some institutions, they collect a lot of potential ADRs. Then your pharmacy and therapeutics committee deliberates these ADRs if these are actual ADRs or potential ADRs that can be reported to the FDA. Ang tanong, another question is that mas root question natin, no? Meron nga ba kayong nare-report? Do you even have ADRs occurring in your hospital? If not, they might be going undetected or unreported and unreported. So undetected and unreported. So sabi nga po ni Sir Melvin kanina, pag hindi mo ni-report, mangyayari siya sa iba. So what are things to watch out for in preventing adverse drug reactions? So you should know the allergy status of the patient. An allergic reaction is an adverse drug reaction. It might have happened because you failed to take the medication history of your patient or the allergy history. Kaya po very, very, very important po ang pag-take note ng allergy. Also on endorsement, palagi niyo pong ilalagay if the patient has allergies or not just sa food, no? Hindi lang po pagkain. Kasi for example, ako, I am allergic to a certain kind of food. Allergic ako sa pusit. So hindi ako pwedeng kumain. But sa medication, you also need to endorse every time. The patient has no known drug allergies. Ganun po. Dapat ganun. Practitioners need to be adequately trained to monitor medication effects. So be able to differentiate side effects from a potential or actual ADR. So nagkakaroon din po tayo ng ADR because of dosing regimens. For example, what constitutes as an appropriate dose? So dosing regimens may lead to under and overdosing and may lead to potential adverse effects. Just so you know, failure or underdosing may lead to failure in therapy. Hindi epekto yung gamot and it is classified actually as an adverse drug reaction, failure of use. Ibig sabihin mali hindi umepekto yung gamot because the dose was inappropriate. So it may lead to underdosing. Your underdosing led to a failure of efficacy. Ayan. This is from the Joint Commission. Dito natin differentiate what's the difference between ADEs, ADRs, and medication errors. Kasi ang side effect po, intended na siya. I mean, it's already indicated or labeled na magiging extension effect siya ng gamot. Sorry po, I will mute you po. Yan. Side effects po are usually extension effects of the effect of the medicine. But an adverse drug event is an injury. Injury na po may nangyari na. Resulting from a medical intervention related to a medication, including harm from an ADR or a medication error. Ano bang ADR? It's a response to a medicinal product that is noxious and unintended. And that occurs at doses normally used for humans for the prophylaxis, diagnosis, treatment, blah, blah, blah. So, ang ADR po, nangyayari siya in normal doses, in normal therapy. Hindi na-check na po na validate, pero nag-respond yung patient kasi pwedeng nag-allergy, pwedeng long-term effect siya, di ba? Pwedeng akala mo normal dosing pero based sa weight hindi pala. So hindi umakma yung dosing, nag-underdose ka because you thought it was normal dosing pero mabigat pala yung patient, so hindi siya nag-respond. It's a hyper response usually to a medication. A medication error is any preventable event that may cause or lead to inappropriate medication use or patient harm while the medication is in the control of the health professional or the patient. Ulitin ko, kasama po ang pasyente sa medication error because the patient may be non-adherent to your medication. Ayaw niya. Pwedeng kahit in-instruct mo na tapusin pong antibiotic ng 7 days, pero sabi ni patient, ay magaling na ako sa 5 days. Hindi ko na tinapos. then na-readmit siya, naging multi-drug resistant yung organism. It's a medication error from the patient. Ano nangyari? Yan. But in every step of the medication use process, a medication error can happen on the prescriber end, on the pharmacy end, on the nursing end, until monitoring where everyone will be involved until the patient discharge. Pati si patient po kasali in medication errors. So what's a significant ADR? A significant ADR is an ADR in which the patient's outcome is death, life-threatening, hospitalization, disability, or required intervention to permanent impairment or damage. Yan. In monitoring your patient, one crucial step in monitoring medication therapy, I will mute you po, Alice po, sorry. So, in drug therapy po, in monitoring your patient, one crucial step in medication therapy monitoring is your dose. Kasi po, di ba, we want to avoid over and underdosing of medication. So it's usually done in tailor-fitting a patient's medication therapy. It also depends on patient characteristics. Dito rin po papasok yung laboratory parameters ni patient. Ano ba yung mga laboratory parameters that might influence dosing in a medication? So pinakamadali is creatinine. Creatinine clearance mo ng patient and your AST and ALT levels sa liver. So that's the easiest laboratory result that can influence dosing. So how is dosing computed? So it's usually based on weight and the laboratory parameters. Ang tanong, do we still base our dosing on age? No undergrad ko kasama pa, pero as far as I know ngayon, hindi na. So we mas accurate po kasi ang weight-based dosing for pediatrics, who is yan. When is a dose ang tanong diyan, when is a dose appropriate? Who checks your dose? Sige po, sa mga prescribers natin, mga physicians na nandito, prescribers, dentists, sino po ang nag-check ng dose at ng order ninyo? Let's see in the chat po. Please answer in the chat. Or for those who are in institutions, who checks a dose of the patient sa institution ninyo? Hello. In the chat po sana. Sino po ang nagche-check ng dose ng gamot ng patient ninyo? Buhay pa ba ako? Hello. My internet connection is unstable. Can someone answer in the chat po? Walang nagche-check po ng dose sa hospital po ninyo? O wala. Okay, wala na po. Okay, sirit na, ganun. Who is a designated qualified individual to check those appropriateness? So you need to ask these questions in your institution. For nurses, di ba? For nurses, is the dosing regimen of the patient aspirated or prepared appropriately? Tama po ba ang pag-prepare ninyo ng dose? Ang tanong, paano niyo nasasabing tama? I don't want to preempt the next speaker, pero yun yung kasi magiging significance, no? Checking. So wala po, no? I think no one is answering. Sino po nag-check ng dose ng patients ninyo or wala? Wala pong sumasagot eh. Okay. So maraming salamat po for the non-participation. Ito. Ay, shucks. It's si Ma'am Carmela. It's usually the nurse who prepares and gives the medication. So it is the nurse who does it. Pero ma'am, another question is, how do you know that the dose you give is right? yun yung actually yung presentation ng next speaker mamaya. So, yun po, that's another question, no? Oh, kawawa naman yung nurse namin yung responsibilities. I mean, in medication, no? So, actually po, the patient safety standard by the Joint Commission in medication management says that a pharmacist is a qualified individual to check drug and dose appropriateness. So, pwede po si pharmacist ang mag-check for appropriateness ng dose or ng drug itself. Next. Correct timing is critical in obtaining and interpreting patient-related data. Sabi ko nga po kanina, no, some laboratory parameters might need strict monitoring times. For example, INR. Dapat po medyo crucial tayo on timing when should it be taken. Standardization of medication administration time and pertinent monitoring time should be built into the workflow. Question for the institutions here, mga hospital. Meron po ba kayong standard administration time? Please answer in the chat box po. Meron po ba tayong standard administration time? The ones here are answering, sabi nila, meron. Nakapapel ba? Hindi. So, yes, Sir Clifford, yes, may standard time kayo. Naka-specify ba what times are yung every X hours versus X times a day? Mga ganon?
Yes, sir.
Yes. Do you have a policy on your standard time?
Yes, sir.
Oh, okay po. Wow. Ma'am Carmela, it is the nurse's responsibility to know how to compute it properly. Ma'am, yes, we know. We know, well, it's not just the nurse. It's everyone else in the process. It should be everyone that should be knowledgeable on how to compute the medication or drug calculation. So dapat po, ito po yung magiging presentation mamaya ni Dr. Athena, no? It's how do you double check also. Ito, titratable medications should also follow a particular timing. Okay, what are titratable medications in the hospital setting? One is, well, if we're still doing sliding scale insulin, it's a titratable medication. Usually norepinephrine, nicardipine, yan, yung mga merong hold for SBP, di ba, not greater than ganito, hold if heart rate is not greater than ganito, who is not, yan. So dapat po itong titration or titratable medications, meron din silang pina-follow na particular timing, and this also needs to be in a policy. Hindi po pwedeng dahil alam naman po natin, pero alam naman po natin talaga. Pero kapag dumating si safety, pag dumating si accreditor, dumating yung legal mandate mo, where is your policy? Ang tatanungin. Dumating si ISO, di ba? Dumating si accreditation, tatanungin, nasaan po ang policy mo? Ay, hindi alam na namin yan. If it is not written, it is not done. Di ba? Standard time, o dito sabi po ni mga taga-SI, meron po silang standard time. Ang tanong, nakapapel ba? Hindi. So wala kang sinusunod talagang standard time. Kasi nandun dapat yung policy mo on ano yung mga standard time, ano yung mga exempted from standard time, how do you adjust a medicine that is not started on the standard time. Yung mga ganon. Dapat covered lahat yung ganong situations ng standard time. So in transcription, it impacts safety when the data are inputted correctly. Wrong dose, wrong laboratory result, wrong interpretation. So it may document, you should document that a transcription error also occurs if you are documenting data for the wrong patient. That's why, I think may sinabi ni Sir Melvin kanina, validate or verify for two identifiers for the patient. Kasi baka po yung chart ng patient nyo, ibang patient na pala ang sinusulatan nyo. Di ba? What are contributing factors? Lack of utilization, inefficient workflow, ang toxic, lahat naman po tayo. Or lack of, sabi nga po ni Sir Melvin, no, lack of 2 patient identifiers. This is a patient safety standard. Lack of 2 patient identifiers. Lack of a common place to transcribe the values or the drugs. Someone's not muted again. Drug transcriptions. So in drugs, no, it may impact when the numbers are confusing or inputted correctly. Prescriber legibility impacts transcribing. So if there are prescribers here that were awarded with the Stylus Award for physicians for the prescribers last Monday dito sa hospital namin, congratulations, because you were validated to have a good impact in prescribing practices. We awarded po kasi mga physicians who have very, very good handwriting, not just handwriting, no, but also ordering and prescribing practices. So sana po lahat po tayo, no, legible ang handwriting para maintindihan po not just the nurse but also everyone else that will be reading the chart. There might also be confusing drug names or names of drugs that are very hard to spell. For example, levetiracetam. Yan, usually lalagay nila ni Dr. Kepra, lalagay ni Dr. Ivetra. Pero it's very much appropriate to write in generic names. So in data interpretation, the root causes of incorrect interpretations of patient data usually are distractions, interruptions, workload, lack of training, confusing data. Ganito, kapag nag-interpret po tayo ng laboratory values or radiologic findings, we should minimize distractions, interruptions, kasi po baka po hindi po natin ma-interpret ng mabuti yung nakalagay sa paper. So, especially pag paper pa po yung mga results, no? So, it might lead to a misinterpretation. So, interpreting patient data requires focus and understanding of the process. So, there should be clear documentation to facilitate correct interpretation of your data. So, what are the relevant documents in monitoring patients' medication therapy? So, there are laboratory-specific data, your radiologic findings, your MAR. Your MAR is a very relevant document po kapag nagmo-monitor ng patient or nag-check ng patient kasi doon po natin nakikita kung nabigay nyo ba talaga yung gamot. Or when was the last medication administered? Anong oras ba huling binigay? When a patient went into an ADR, ano ba yung huling gamot na binigay mo? And, di ba? And what was the time? So your MAR is very important. The admitting notes, especially the medication history, the medication order sheet, and the progress notes of the physician. Na-order po ba ni doctor? Kailan niya in-order? So na-carry out ba yung order? These are things that usually dapat hinahanap when monitoring a patient's medication therapy. Wait lang po. This is my second to the last slide actually. Yesterday, napakita na rin po ito ni Miss Christine. This is the interdisciplinary team. It's not the physician alone. It's not the nurse alone. It's not the pharmacist alone. It's everyone else in the process. Monitors a patient response or non-response to therapy. Diba? In the institution, we make sure that the patient gets out of the hospital well. So monitoring is a collaborative effort. As a pharmacist, no, ako po, as a pharmacist, we offer drug knowledge and application of pharmacokinetic and pharmacodynamic principles to medication therapy. So it's always good to ask your pharmacist regarding information on medications. Hindi po kami naka-confine lang sa butika at magbibigay lang po ng gamot. Sayang naman po yung mga inaral namin kung ganun lang po ang tingin nyo sa amin. You can ask a lot of questions, even on preparation. We can assist you with that. Dito sa hospital namin, marami po nagtatanong sa amin and we welcome those questions because it helps you nurses on how do you prepare the correct medication and how do you prepare it properly. Saan mo siya i-infuse? gaano ba kabilis ang infusion rate, ano ang diluent niya, ano ang final volume. So there are very technical stuff na both nurse and the pharmacy should collaborate into, especially on drug administration. Nurses, since sila ang nakakakita ng pasyente, they can detect and notify potential or actual ADRs and alert ADEs or adverse drug events. Yun, they should have a monitoring or reporting system din. Yun, please report. Sabi nga po natin, kapag na-report po, iniiwasan nating mangyari sa hinaharap yung nangyari na yan. Physicians can analyze monitoring information. So kapag may laboratory, nag-transmit si nurse ng critical result, critical laboratory value, the physician can analyze the information. Yun, it takes a whole team to monitor your patient. Hindi lang po si nurse. Yeah, usually medyo kawawa naman si nurse kung puro siya lahat, di ba? It's always a team effort from everyone in the process. Ay, no audio? Hello, narinig pa po. Narinig po ako?
Okay na, sir.
Okay
Pero
na po.
nakat kanina.
Nakat. Pero nakalimutan ko na yung sinabi ko. It takes a team to monitor your patient. Yun. Sorry, medyo pangit po yung connection din po namin dito. But yun, I think I am on the last two, no? Ayan. So, your pharmacy and therapeutics committee should have medication use policies. They should also have policies on monitoring, analyzing, and preventing medication errors. Ang tanong sa hospital po ninyo, meron po bang nagre-report and nagko-collect ng mga errors even if it does not reach the patient? Hindi po kailangan dumating sa pasyente. Ang tawag po sa mga errors na hindi pa dumarating sa pasyente ay near miss. So, meron po mga errors na hindi po umaabot sa patient. And ang tawag po dito ay near miss. Sir Tommy, nagdo-drawing ka, nag-annotate ka. The nursing service naman, I think should also collaborate with your pharmacy and therapeutics committee in terms of the standard administration time. So, dito po sa amin, sa hospital namin, we will be standardizing. Nawala ako. Hello? Am I still audible po? Okay.
Okay na, sir.
Okay na po. So, ulitin ko po sa nursing service, you should collaborate with your pharmacy and therapeutics committee with regards to your standard administration time. So, dito po sa amin, we will be lobbying our proposed standard administration time with everything in between. Paano pag hindi ka standard time, nag-start ng medication, kailan po siya mag-a-adjust, kailan po ang next dose, kailan mo siya ibabalik sa standard time. Dapat yun yung laman ng policy mo. Ano yung mga gamot na hindi kasali sa standard time? We have medications that do not follow usually standard time, no? Standardization of drug administration. Ito issue ko yun dito. Dito ko na sinabi, no? So, issue ko yun dito. So, pag sinabi ni doctor na IV, okay, for institutions, for hospitals, pag sinabi po ni doctor na IV, di ba? True IV. IV ano? Di ba? IV push ba? IV push or IV bolus ba? Or IV infusion or IV drip? Anong klaseng infusion? Is it a continuous infusion? Is it an intermittent infusion? Is it an extended infusion? So, for physicians, specify your drug administration kasi si nurse po yung nalilito. You see how the domino effect happens. Kasi pag hindi tama or malabo or pag vague yung order ni doctor, hindi rin maiintindihan ni nurse at hindi rin siya makaka-interpret ng maayos ng order. So mangyayari, may chance na magkamali siya. Ano ang mangyayari? Sunod-sunod na po yan hanggang kay patient. Okay? So sana po we should be very, 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 very specific when it comes to specifying drug administration. Also drug knowledge. So dapat po familiar po tayo sa mga binibigay na gamot, hindi po yung para po sa inyo, ganon. So dapat po we know kahit simple lang na what the drug does. So this is for your seizure, this is for fever, this is an antibiotic, this is a pain reliever, kahit yun lang. Kasi we have encountered answers na sinasabi, ay para po sa inyo. Nako, mahihirapan tayo dyan. Diba? For physicians, you should have your medication order policies. So, on monitoring your patient, you should be very specific on how you order your laboratory values, your indicators, and your drugs. Ang tanong, lahat ba ng mga ino-order natin ay nakapapel, nakapolicy? For example, the use of abbreviations. Pwede ba? Are you allowed to use abbreviations? Actually, bawal. So, dapat by word lahat. The routes of administration, ano bang default pag sinabing IV? Is it an IV push, IV dip, mga ganon. So, dapat po naka-policy po on how you order your medications correctly and the laboratory values and the diagnostics. So, for pharmacists, siyempre kami dito sa pharmacy, we should empower our profession din. For hospitals, no, we are more than dispensers of medications. Ang dami po nating patient data na nakikita and nai-interpret. Dapat po on our end din, if we detect a potential medication error, harangin mo na, raise the concern na. If you see an error that might happen to your patient, on your end, on your process, di ba? Kung nakuha rin nasa dispensary na, in order na ni-nurse through the system, sample mali yung na-input niya, harangin mo na, i-correct mo na kasi ang mangyayari dyan, it's still the domino effect. Pag hindi mo kasi kinorek, darating siya sa patient mo and it's too late. So, sa amin sa pharmacy namin, we are very proud of our double checking process, which will be also, I think, discussed by Dr. Athena later. We are very proud of our double checking process kasi we make sure that before we finally dispense a medication, dalawa ang gumagawa nun. May nag-check na isa. So there are 2 people dispensing the medication. One who fills the medication and the 2 double checks the medication. Pero hindi pa po kami umaabot sa dosing, pero pag may nahuhuli kami, we raise the concern immediately. We also hope you have clinical pharmacists around. Nabanggit po ni Dr. Between kahapon na there will be positions for clinical pharmacists in level 3 hospitals. Sabi nga po medyo rare Pokemon nga daw po ang mga clinical pharmacists. We hope you have. I think CIMC has one. Kilala ko po ang clinical pharmacist nyo. City of Ilagan. Kilala ko po yung clinical pharmacist nyo. Nagkausap lang po kami kagabi. You empower them. Ang dami po nila may offer in terms of medication information and application of what we have learned in the pharmacy. You empower also your fellow pharmacists. Ang daming nilang pwedeng gawin in terms of intervention, medication-related interventions. So my last slide is this statement again from my friend. Sabi niya, poor pharmacology equals poor therapeutics. Hindi ko alam kung 100% agree na ako dito. I have been repeating this question in my head for so long. Simula nung sinabi niya sa akin to na nadi-disturb talaga ako kasi parang tama siya na hindi. Pero in therapeutic decision making, you should know what the medications are doing. So I think it's kinda true to some extent. Kaya lagi itong binabalandro itong statement nando kasi for prescribers, for nurses, for pharmacists, if we have weak backgrounds in pharmacology, hindi tayo makakamanage ng patient ng mabuti in terms of medication therapy. And with that, I end my presentation. Maraming salamat po.
Thank you very much, Doc Ray, for that very comprehensive lecture on the monitoring in the medication use process. So after At this juncture, I will now introduce our next and the last speaker for this today's webinar on medication safety. Phone.
Yuki.
Okay, please allow me to share my screen. Our speaker is a patient-oriented pharmacist with a Doctor of Pharmacy degree. She has a strong background in case-based pharmacotherapy and pharmacovigilance. She is an enthusiastic team player driven to achieve exceptional patient outcomes and uses evidence-based pharmacotherapy for quality patient care. She finished her Doctor of Pharmacy from University of Santo Tomas and Bachelor of Science in Pharmacy in Central Escolar University. Currently, she is the supervisor in the clinical pharmacy section. So please help me welcome Dr. Athena Vernice C. Carlos to discuss importance of validation, impact to patient safety. Kindly wait for a while as the speaker will share her slides. Okay.
Hi, good morning.
Good morning, ma'am.
Am I audible po ba?
Ito ang patry nga po.
Ikaw mag-open yun.
Naligan natin.
Good morning, magandang umaga.
Okay. Pero yung mukha niya, nasaan?
For a while lang po, may inaayos po kami sa video.
Ayun.
Okay, let us proceed na po. So this is the last lecture or session for today's webinar. So I'm going to tackle about the importance of validation. So magandang umaga po. Good morning to all our participants. So this would be just a concise and direct to the point discussion or session on independent double checking or validation. So I hope lahat naman po tayo sa kanya-kanyang unit nagva-validate po tayo. Okay? Okay. So let us proceed to our objectives for today. So at the end of this lecture, the participants are expected to know the definition of validation, to know the importance of validation, to know the steps in doing validation or double check, and to know the list of what to check during validation. So what is the word validation? In many approaches, marami pong meanings ang validation. For example, validation is an external approval of the accuracy or validity of something. Or in other approach, validation, in a more personal level, it is the affirmation of another person to a person's worth or validity of his or her feelings. Okay, di ba meron tayong mga statements na yung feelings ko should be validated. But how about in healthcare? What do we mean about validation in healthcare? So for this session, I am going to speak about validation and independent double checking interchangeably. So for the definition of validation, it is also known as independent double checking. Independent double check or validation is a strategy that has been widely promoted in healthcare to help detect potentially harmful errors before they reach the patients. So what do we mean by this? So in all medication use process, in all the points of medication use process, we should always use validation or independent double check. So in all approaches of validation, in all its definitions, there is one similarity among the definitions. It requires at least two people. Always remember that you cannot validate your own work. If you validate your own work, it has a confirmation bias. So have another person or separate person to validate your work. So for validation, it is not only applicable in healthcare, but it is also applicable in the corporate world, like in the offices wherein they validate their papers. And why do we use validation? Because as humans, we tend to make mistakes. What do we call that mistakes? We call those human errors. So, nagkakamali rin naman tayo kapag meron tayong mga ginagawa. So, dito papasok ang importansya ng validation or independent double check. So, in validation, we are sharing the responsibility
for safe medication use, not only the responsibility, but the accountability for safe medication use. And what are the benefits of validation? It reduces the frequency of errors. What kind of errors? Medication errors, from prescribing errors to transcribing errors, dispensing errors, and administration errors. The benefits of two-person validation is it reduces bias and increases effectiveness in reducing errors. It also detects potentially harmful errors before they reach the patient. So we have many meanings of validation or independent double checks. What are those synonyms or meanings of independent double checks? So we have here, we have verify the data, scrutinize the data, scrutinize the order, the prescriber's order, the medication, confirm the dose, review the medication, analyze the medication, examine the order, examine the data, substantiate the dose, the medication, and the patient, and also cross-check all data of the order. Okay, so what are these studies? Studies on the impact of double check systems. So marami na pong nakonduct na study from 1998 up to 2018 for affirming the effectiveness of validation. For example, the study of Campbell, use of process control charts to monitor dispensing errors and errors detected with an independent double check. So what was the result? An independent double check detected 95% of errors. Imagine it detected 95% of errors, leading to a reduction in the error rate from 5% to 0.25%. So this testifies the efficacy or the effectiveness of independent double checking. Another one, introduced artificial errors. They have introduced artificial errors into the medication cards and sample pharmacy orders and measured detection rate with an independent double check. Again, they use the independent double check and the ability to detect and correct 95% of errors with an independent double check was not affected by workload or time on shift. So what do we mean by this? So double checking, independent double checking takes some time. It depends on the workload or the time on shift if it affects the effectiveness of the double checking. However, from this study conducted by Gracia and his or her friends, they have the may adjourn. The workload or time on shift did not affect the double check systems, right? Am I audible po ba? And lastly, the study of Douglas, they compared single check to double check by emergency department and critical care nurses during adult sepsis simulation. Use of a double check was significantly more effective than a single check at detecting wrong vial errors. Also more effective but less pronounced for detecting weight-based dosing errors. So they have detected wrong vial errors using double check instead of single check. So double check was significantly more effective than a single check. So lahat ng mga studies na to, they testify and affirm for the effectivity or the effectiveness of the independent double checking. So may illustration tayo, the Swiss cheese model. I hope familiar tayo dito sa Swiss cheese model na di-discuss na siya during the Patient Safety International Goals. So again, ano po yung Swiss cheese model? Swiss cheese model is a safety incident, a model of safety incident created by Sir James Reason. This Swiss cheese model is used to explain the occurrence of system failures, such as medical mishaps. The Swiss cheese model is a model of accident causation used in risk analysis and risk management. So this is a model of causation of incidents or accidents. And this is used to identify system failures. So nakita na po ba tayo ng example ng Swiss cheese? Ano yung mapapansin nating distinct feature ng Swiss cheese? Meron siyang mga holes. As you can see in the illustration, each slices of cheese has holes. So anong tawag po natin dito sa slices of cheese? For this illustration, we have 4 slices of cheese. These are layers or multiple layers of protection. So for us, in the hospital setting, ang nilagay ko po dito sa cheese slices, yung medication use process from prescribing, transcribing, dispensing, and administration. What does these multiple layers of protection means? This means that we have a shared responsibility or shared accountability from the start of the medication use process. But as have discussed yesterday by our speaker, the medication use process does not start from the prescribing only, but from the selection and procurement of the medications. Right? We could also include the selection and procurement of medications here in the Swiss cheese model. But for this example, we will be using the medication use process from prescribing to administration. Remember that no layer is perfect. May kita po natin na each layer, each slice ay may holes. So ano po yung holes na yan? Yan po yung mga inherent weaknesses. Yan po yung mga mistakes or failures in the medication use process. So for example, yung line, diretsong line po natin na arrow line, from that is called the near miss. And kapag nakarating siya sa administration, nakalusot siya sa administration, it already reached the patient. It is a medication incident. For example, let us cite some example of incidents or near miss. For example, here on your left, we have an use of error-prone abbreviations. Remember po, we have list of do not use abbreviations because they are error-prone by the ISMP or the Institute for Safe Medication Practices. One example is the abbreviation of units. Iba po ang abbreviation ng units ay letter U. So for example, our prescriber ordered 10 units of insulin 70/30. Okay? Ang nilagay ni doktor sa order niya, 10U. Medyo magulo yung sulat ni prescriber natin. So, for the lumusot siya, near miss na yon. Kasi the prescriber used error-prone abbreviations. It is an opportunity for error. Then the nurse read the order or transcribed the order, but the nurse did not understand well the order because the letter U was written as if it looks like number 0. Okay? So the nurse did not validate the order back to the physician and assume that the order is 100 units of insulin 70/30. Just for example. Then the nurse transcribed it and ordered it to the pharmacy. Okay, we have muted some of the participants po. Ano? Okay, don't forget to mute your mic na lang po. Okay, thank you. Okay, nasa na po tayo? Nandito na tayo sa dispensing part. Okay, ang na-transcribe po ni nurse ay 100. So, the pharmacist being proactive of the order, the pharmacist is just being proactive of the order because the pharmacist has not encountered yet an order of 100 units in a single administration. So the pharmacist validated or confirmed if the units is really 100. And then the nurse checked the order and saw that it may be 10, right? Kasi baka sinulat ng doctor 10 units or 100. So hindi siya sure. So nag-check back siya or nag-validate siya pabalik sa doctor. Okay, ang sabi, the doctor confirmed that it is 10 units. Okay, so makikita natin dito na intercept na siya sa dispensing. Hindi na siya nakarating sa administration. So that is an example of errors arising from the medication use process. Remember po, magkaka-connect po itong mga to. So, an error committed from the top will be carried on from transcribing, dispensing up to administration. So careful po tayo sa mga orders natin or sa mga binavalidate natin. But the point is to always validate everything that we do. Okay, so that is one example for the Swiss cheese model. Okay, so in independent double check, ano po ba yung mga tinitingnan natin or yung mga chine-check natin? For example, comparison to prescriber's order. Ano po yung mga tatanungin natin? Ano yung mga titignan natin? Is this the right patient? Is this the prescribed drug? Is this the prescribed dose, strength, rate of infusion? Is this the prescribed route of administration? Is this the prescribed frequency or time for drug administration? So ito po, tinitignan natin yung correctness of the order based sa prescriber's order. For example, mag-cite na lang po ako ng common example na ginagamit namin sa mga seminars. Kunyari po, yung pharmacist, nakatanggap siya ng prescription of benzathine penicillin. Benzathine penicillin na naka-round the clock siya. For example, every 8 hours. And yung order nakalagay, kailangan niya ng 4 vials. So, kapag alam po natin yung nature of the drug, alam natin yung use niya or yung indication niya, alam natin kung paano siya ibigay, magtataka tayo bakit may reseta na benzathine na may 4 vials and round the clock siya. Okay, so validate ito ni pharmacist. Baka naman mali yung patient. Pero hindi. Mali yung drug. Baka may mali sa drug. Ano po ang gamit ng benzathine penicillin? Baka na pagpalit siya sa benzyl penicillin. So you will have to confirm if it is really benzathine penicillin or benzyl penicillin. Remember po, again and again, sa benzathine penicillin natin, meron tayong stock dose of 1.2 million units. Ang benzyl penicillin po natin, yung penicillin G, may stock dose tayo of 1 million units and 5 million units. So nakalagay sa reseta, benzathine 1.2 million units every 8 hours. They need 4 vials. So validate the indication. For example, ang indication niya for late onset syphilis. So pag yun ang sakit, ang gamot ay yung benzathine. Benzathine 1.2 million units. Pero a single dose only of 1.2 million units to 2.4 million units. So ang dapat na nandyan lang, maximum of 2 vials. And administered intramuscularly, never intravenously. So if the pharmacist, yung pharmacist hindi niya alam ito, the error will not be intercepted. It may reach the patient. So ito po yung importance of independent counter-check or double-checking or validation. The pharmacist may validate the order back to the nurse or back to the physician. What are the additional checks for independent double-checking? Does the drug's indication match the patient's diagnosis or conditions? This is drug appropriateness. Does the patient really need that drug? Is this the right formulation of the drug? What are the example for the right formulation of the drug? For example, for our different types of insulins, our insulin 70/30, our insulin regular, or insulin N. Is the dose appropriate for this patient based on the patient's weight, age, or laboratory values, if appropriate? If ano po yan, pediatric patient, we will base the dosing on the patient's weight. Has the dose of a liquid medication been measured correctly? Has the right type of syringe or cup been used? Okay, ang common po dito yung insulin syringe natin. And yung paggamit ng tuberculin syringe or yung 1 ml. So hindi po equal ang insulin syringe and yung tuberculin syringe. Yung insulin syringe po, measured na siya in units and ginagamit siya sa insulin. Kapag for example, aspirate 4 units of insulin. Pag ginamit mong insulin syringe, nakalagay doon yung graduation na or measurement na 4 units na yun. Pero kapag sa, for example, 5 ml syringe, nag-aspirate ka ng 4, hindi na yun equal sa 4 units. 4 ml is not equivalent to units. So you have to convert, you have to calculate. Okay, 4 ml of insulin is equal to 400 units. So, 100-fold difference siya to the when compared to the order. So, this might result into a sentinel event. It may lead to severe hypoglycemia and may even lead to death. Does the patient have any allergies or cross allergies to this medication? Importantly, our penicillins. Does this patient have an allergy to penicillins? Okay, for independent double check for IV push or parenteral infusions, are flush syringes available and labeled? Is this the correct diluent and volume of diluent? Tama po ba na sterile water or plain sodium chloride ang dapat na gamitin for diluent? Is the total volume correct? One example for this is yung to make a certain volume or to add a volume. So we have orders for example, reconstitute, for example, norepinephrine to make 250 ml, for example. And we have a stock dose for norepinephrine of 10 ml, for example. Sa 250 ml, i-add mo ba dyan yung 10 ml or to make ka ng 250 ml na total volume? So we have to be vigilant dito sa total volume or final volume. Kung hindi po, pwede mag-iba ang final concentration. Okay, for infusion pumps, are pump settings correct? Tama po ba yun sa pump settings? Is the infusion line attached to the correct port and pump channel? Is the rate of a bolus dose correct? Okay po. So kapag potassium chloride, pag KCl po, we have different maximum rates and maximum concentrations for potassium chlorides. For peripheral, we have a maximum concentration of 10 mg per 100 ml and a maximum rate of 10 mg per hour. Whereas for central administration, we have a maximum concentration of 20 to 40 mg per 100 ml and a maximum rate of 40 mg per hour. Right. So I will just play a video. We got this from our previous lecture. So this is helpful in understanding double checking. Wait. Sorry.
Virtual Round 7, High-Risk Medication. These videos illustrate common safety errors and are not intended to reflect best practice. They are designed to provide practice in identifying safety errors.
Hey Sally, could you verify this pain medication? I'm giving Jillian morphine, 0.25 milligrams of morphine. Okay. Oops, hold on.
Excuse me, my baby is in a lot of pain.
I'll be with you. One moment, okay? I'm coming. I'll be there in a minute. Thank you. Can you verify 0.25 milligrams? I gotta go. 2.5 milligrams. You're all set. Yep, got it.
Then pause yung video.
Hey Sally, could you verify this pain medication? I'm giving Jillian morphine, 0.25 milligrams of morphine. Okay. Oops, hold on.
Excuse me, my baby is in a lot of pain.
I'll be with you. One moment, okay? I'm coming. I'll be there in a minute. Thank you. Can you verify 0.25 milligrams? I gotta go. 2.5 milligrams. You're all set. Yep, got it.
Okay, so ano po yung nakita natin sa video? Unang-una, distracted yung magva-validate. Nagsa-cellphone siya. So dapat meron tayong undivided attention kapag nagva-validate. Diba po kapag nadidistract tayo at may magpapavalidate sa atin, hindi tayo makakapag-focus doon sa kung ano yung pinapavalidate ng kasamahan natin. So dapat meron tayong undivided attention. Kahit ano man pong bagay yan na may sinasabi sa atin, kapag divided yung attention natin, hindi tayo makakapag-focus. Then naka-open yung door. It is open for distractions from other co-workers or even the patients. And nagpa-fast track validation siya. Sinabi niya kung ano yung dapat niyang i-validate. Kung ano yung dapat i-validate ng kasamahan niya. Sabi, ito 2.5 milligrams. Hindi man lang chinek yung nag-validate yung order mismo. Kung 2.5 milligrams ba yan or 2.5 ml. Hindi chinek kung tama yung pasyente, kung tama yung gamot, kung tama yung dose, at kung tama yung inaspirate niya. So you have to be there physically and mentally to validate everything. With that, independent double checking should be validated by two separate people or conduct double checks by a second qualified person. Okay, dapat po may kasama tayong iba. Hindi natin pwede i-validate yung sarili natin ginawa kasi it may be prone to bias. Ang gusto lang nating ang makita lang natin ay yung gusto nating makita. For example, for bias, we will only see what we are expecting to see, even if error has occurred. So you have to validate it by a second qualified person. For example, a person preparing a medication, pharmacist recalculates the prescribed dose, the pharmacist prepares the syringe, the pharmacist compares the product to the order, and the validator of the prepared work is a nurse. The nurse independently checks the order. The nurse recalculates the dose, and the nurse compares the results with the dispensed product for verification. And one example, for example, ako yung magpapavalidate. Ang validator ko, for example, si Ma'am Cherry. Sabi ko, pinakita ko yung insulin syringe sa kanya. Sabi ko, Ma'am Cherry, 5 units of insulin to. Pwede pa check? Tama po ba yun? No, it's incorrect. Dapat po ipakita natin yung order at ang dapat na magbabalidate ay si Ma'am Cherry. In-influence ko na yung pagbabalidate niya. But paano ko siya na-influence? By saying, this is 5 units of insulin. Can you check it? The person asking for a double check should not influence the person checking the product. Let that person double check, validate the product. Use independent double checks judiciously. What do we mean by judiciously? By good judgment. Of course, the targeted tasks and medications that require an independent double check should not be based simply on those that have historically been double checked, but rather on a careful assessment of processes and medications. For example, our intravenous or epidural opioids, our IV insulins, our IV heparins, and our IV chemotherapy. So mapapansin po natin, most of these examples are high alert medications. The primary reason for the independent double check, what you are trying to catch, and what specifically needs to be verified to achieve that goal. Ano yung tinitingnan natin pag nag-i-independent double check tayo? Is it catching errors? Whether an independent double check is the best strategy to detect a specific risk or prevent a specific error. How the independent double check fits in with other risk reduction strategies that might address the same or similar safety concern. So, ano ibig sabihin dito? Do not rely solely on independent double check. Dapat may kasama yung ibang risk reduction strategies. For example, for our high alert medications, ano yung ibang risk reduction strategies bukod sa independent double check? Maglagay ka ng label. Okay? Importante po ang label sa HAMS. Nakalagay doon, high alert medication double check. How about for sound alike and look alike drugs for salads? Di ba po? Kapag may salads tayo, use Tolman lettering in storing your salads and separate your salads. So, help the independent double check by integrating other risk reduction strategies to reduce medication errors. So this is the ISMP recommendation for independent double check when ordering a drug, calculating a drug, preparation of a drug, and administration of a drug. Two-person validation po ito. The nurse 1 and the nurse 2 check order for drug separately. Nurse 1 and nurse 2 calculate drug separately. Pwede rin pong nurse and pharmacist. For the preparation, nurse 1 prepares drug and then silently shows result to nurse 2 to confirm. And the administration of the drug, nurse 1 administers drug. And the nurse 2, pwede rin siyang nandun while the nurse 1 is administering the drug. So I think this is second to the last slide. Ano po yung take-home message natin sa importance of validation? Validation is a good patient safety practice. It reduces frequency of errors. Validation prevents patient harm. So pwede natin ma-intercept yung errors in all medication use process. Validation needs team effort. Kung makikita po natin yung Swiss cheese model natin kanina with the medication use process, it is a team effort. So I want to end this presentation by showing this quote or this line from a study or from a book by Linda Cohn, Janet Corrigan, and Mona Donaldson. The error is human, but errors can be prevented. Safety is a critical step in improving quality of care. So after all, we are all humans. So the earth is human. What do we mean by this? This asserts the problem that the problem is not bad people in healthcare. It is that good people are working in bad systems that need to be made safer. So this is not in an individual level, but in a system level. So applying validation or independent double check is placing a good, safer health system. Maraming salamat po, and that would be all for me. Thank you.
Thank you, ma'am.
That's a wow. Thank you, Doc Ray and Doc Athena, for your lecture. So this is the most awaited event or forum for the two clinical pharmacists. So I'm passing on the stage to Ma'am Rodelita Cabanizas to facilitate the open forum.
Punta na kayo.
Coming from
magandang tanghali po sa ating lahat. Malapit na po tayong mag-lunch, pero very active pa rin po lahat. So we have a question here from Mr. Peter Tom from Kalang. Peter Tom Kalang from SMU. So the question is, among the ways of ensuring safe medication prescription and dispensing, for you, what is the most effective method to reduce medication prescription and dispensing errors?
Hello? Narinig po kami dito? Hello? Hello? Narinig po kami?
Yes, sir.
Narinig ako. Hello?
Narinig ba siya?
Nakikita mo kami? Yes. Okay, yes. Okay. Among the ways of ensuring safe medication method, depende po sa medication use process kasi. So, the first question is, who is a designated individual for you in your institution to check appropriateness? So, according to the Joint Commission Medication Management Standards po, a pharmacist can check for prescription errors. Hindi naman, prescription errors are not errors in judgment in the physician, no, but rather they might have overlooked some steps in in ordering a medication. So, hindi po natin sinasabi na dahil nag-check tayo yung dispensing errors, sinasabi natin na entirely mali na si physician. There should be sabi nga po ni Dr. Athena kanina, na there should be another person checking everyone in the process. So even in the process of prescribing, meron po dapat magdo-double check sa kanya if the medication ordered is appropriate for the patient. So a qualified person is a pharmacist. Also, to reduce medication reducing dispensing errors, nabanggit na rin po ito ni Dr. Athena kanina, always have two persons validating before the medication goes out. Kasi sa amin, sa process namin dito sa SIMC, before the medication goes out of the pharmacy, dalawa po dapat ang nakapirma. So yung nag-fill, tsaka yung nag-double check. Sabi din po ni Athena kanina, hindi siya perfect still, a barrier, but it will reduce the number of errors occurring in your process. Anything to add? Yun, I hope it answers your question po. Any other questions? Kung nandito po si Sir Melvin, hello. Yan. Yeah.
Yes.
You can now type in your additional questions po para sa ating mga speakers. Ito ba? Any additional questions po? So, the importance of validation in medication preparation and administration is talagang napaka-importante po sa atin, lalo na sa ating mga nurses. Kasi tayo po ang heart ng patient care.
Let's give any question po.
Any questions? Another question is from Ma'am Christina Duarte. So, is it possible to still have medication errors in spite of double checking? What instances would that happen? And how would this could be prevented? Sorry.
As Dr. Athena have said earlier, meron po pa rin mangyayari na medication error despite having your barrier, despite having your safeguard. When doing, kung babalikan yung Swiss cheese model, hindi lang po isa kasi yung bukas ng cheese. Ang dami-dami maliliit, ang dami-dami malalaki. Pwede po natakpan ninyo yung malaking bukas lang. Pero pwede yung maliliit, nandyan pa rin. So, there will be an instance where magkakamali tayong lahat. What instances would that happen? It can be at any random time. At any time, pwede ka pa rin magkamali. And how would this be prevented? You go back to your safeguards. Bakit, for example, may double checking mechanism ka na, talaga ang tanong mo doon, nag-double check ka ba talaga? So, have you really checked everything before? Sample sa amin sa dispensing. So, sample sa dispensing. Pero pa rin kaming mali. What happens is ang tanong, na-double check mo ba talaga? O hindi? So, pwedeng na-overlook, pwedeng naging familiar na kasi sa medication, pwedeng naging complacent siya sa dispensing, for example sa pharmacy, babalikan mo pa rin yung process. Balikan mo pa rin yung process kung you don't, sabi nga po sa patient safety, we don't entirely blame the person, but we blame what happened during that process. So you still go back to your process. Ang tanong, bakit, saang part dito nagkamali? On root cause analysis, babalikan mo kasi yung talagang reason bakit siya nagkamali eh. You don't just stop na, okay, ikaw nagkamali, ikaw may kasalanan. Pero the bigger question there is, bakit ka nagkamali? Di ba? Then you go back to the process. Did you double check? Did you really double check? Nakuha mo ba talaga yung actual quantities? Did you nag-promote that ka lang ba just for the sake na masabi na nakapirma ka? Di ba? Ang dami pong factors. So, in any instance in your process, kahit sa administration, you will, at one point, kahit dahil pwedeng walang nag-double check sa'yo, pepekein mo yung drug administration or yung validation or wala talaga nag-double check. Pwedeng ganun eh. You will be complacent. Magkakamali kayo. Tayong lahat sa proseso. There will be one point until we put the safeguards well. Even in sample, for example, sa larger hospitals, there will be times that all of us will make a mistake in the process. Will commit a potential medication error, and this is where quality improvement comes in. Balik ka. How do we improve your process? How do we revamp our processes every time just for patient safety? This is not na para i-burden tayo na ang hirap-hirap naman, daming ginagawa, but what we are doing is for the patient. So prevent, balik ka pa rin, go back to your process, and still it should be part of your quality improvement process. Diretsuhin ko na Ma'am Delete, kasi another safety concern is when physicians ask nurses to perform a task that conflicts with the facility's policy or protocol. For example, a physician may ask the nurse to take a verbal order when the facility has EMRs. The nurse may feel it is unsafe due to a potential transcription error. What is the best thing to do? In patient safety, we speak up. I know Sir Melvin would have been. You speak up and you do what is right. If it's not comfortable for you, sabihin mo, I am not comfortable with this. Diba? We have learned from team steps, no? You speak up. Sabihin mo, Doctor, I am not comfortable with this. Okay lang po. It's entirely okay. From Ma'am Kat Malyabo, are nurses allowed to receive or decline medications given via a syringe pump, especially if they are not properly oriented on the machine? Can I ask help from Sir Melvin about this? Are nurses allowed to receive or decline medications given via a syringe pump, especially if they are not properly oriented in the machine?
Yeah, actually, the answer is already in the question, because the use of the syringe pump will require a special skill. If you are not competent of doing such in the administration using the syringe pump, you are taking risk. And taking risk will compromise soon a consequence that will merely not acceptable, wherein our mindset is always prevention. So if you are not competent and you may not have the confidence to manage administration of drug using the syringe pump, then first, you may refuse. Second, for purposes of the bounded responsibility, you can be assisted and be supervised by a competent nurse. So there are two ways. It is not totally declining your responsibility towards medication administration. And just to add on with the principle said by Sir, there are two principles when it comes to the medication safety. It's all about the accountability and it's all about the responsibility. When we talk about accountability, you admit mistakes rather than blaming others. It will cause the self-realization and it will promote self-growth. Then if we're going to consider naman responsibility, sabi nga, the end does not justify the means. Meaning, if the patient turned to be okay, but the cause itself is somehow a lapse and a shortcomings on our responsibilities, then let us rethink. It will always be the responsibility, even though the patient had leaded to a recovery, but the means itself that leaded the patient to the situation may not be acceptable, then let us rethink. So it's just a two-matter principle, accountability and responsibility. Thank you very much.
Yes, sir. Thank you for the
You are echoing, Ma'am Lily.
Okay. Thank you very much, sir, for the very comprehensive answer. So we have another question here from Ma'am Christina Duarte. Is there a law protecting nurses and sanctions when they receive orders from doctors through phone or verbal, but doctor denies giving the wrong order and something happens to patient?
Hello, good morning. From the question of Ma'am Tina Duarte, actually, it boils down to the policy of the hospital. In the hospital, here at SIMC, we have an institutional policy that verbal orders, we have an institutional policy regarding verbal orders that it should be signed within 24 hours and it should be validated. Just recently, our institution has capacitated all nurses, all healthcare professionals in the institutions regarding the standard communication tool, which is ISBAR or SBAR. ISBAR stands for Introduction, Situation, Background, Assessment, Recommendation. And this will really protect everyone, not only the nurses, Ma'am Tina, but also everyone across the hospital. And besides, additional thing is the silver lining that can protect the nurses about this. For example, the importance of what? Documentation. Nurses should really document all of the orders of the doctor and the importance of check back and validation. Kasi yung ating mga documentation po, our documentation will really guard us regarding, for example, if the doctor denies it, our documentation will really help us and will really will serve as a proof that the doctor ordered it. But I believe naman siguro the doctor in the process of ordering naman po, napaka-importance in every aspect of the medication use and management system. The importance of validation will surely help or will ensure that it is safe. Okay, so may I ask Ma'am Tina if I answer your question right, or if I answer your question po, Ma'am Tina. Ma'am Tina. Okay. Okay, so any words of wisdom, Sir Melvin?
Actually, I agree with you. The decisions, usually decisions, clinical decisions starts hierarchy. So it will always start by the unit, the institution, then it will be cascaded into the perspective of our Republic Act 9173 if it already affect in general the nursing practice. So kung ang nursing in our law, the provisions are very general. But to specify the responsibilities, when it comes to the implementing rules and regulation, it is more institutional kasi it will really depend on the setup eh. Kasi kung for example, if we are talking about yung perspective related doon sa how the nurses will be protected from the phone or verbal orders if ever there are untoward situations that happen, then it will depend on the setting of the hospital if it is acceptable, if that situation, if the regimen is acceptable, if the communication channel is acceptable, because there are some hospitals that telephone orders may not be acceptable, but on the perspective that SIMC is accepting telephone orders or verbal orders, so I think there could be a stringent measure to really protect both parties, the doctor, the patients, and moreover, welfare of our patients. Salamat po.
Thank you very much, Sir Melvin. Are there any questions? Ma'am Lilith?
Hello. Charge nurse. Another is bringing it to the supervisor or manager's attention is also mandatory. Another question, if they still feel unsafe, should they escalate higher up the chain of command?
Hello. Good morning once again. May I also ask first Sir Melvin about it before we can share our answer from SIMC?
Thank you so much, ma'am. When it comes to the perspective of reporting to the supervisor as a mandatory procedure, I think if we will go back to your organizational structure, the line in the organizational structure shows direct relationship. So what does it mean? It means that if in the hierarchy, the staff nurse is reporting to the head nurse or the charge nurse, so there is a direct communication. So is it mandatory from the organizational structure itself? Yes, because the manager and the supervisor is accountable to the ward as well as to the nursing workforce who are acting and performing responsibilities in the ward. So with this accountability as well, direct reporting to the superior could be, should we say, and should be strongly encouraged, and it is highly advisable because the organizational structure itself shows the direct communication with it. So on the other question po, pertaining to the chain of command, how about if, for example, the problem arises that the problem is your supervisor? Yan. This is when it comes to medication safety, when it comes to medication safety. So will this be a consideration to report to higher hierarchy? You must take into consideration yung principle sa management ng exception principle. Yung exception principle, you must manage it first at your level. So if there's a problem that arises with your supervisor, then there must be still a consideration in the organizational structure of the relationship, the line relationship with you as subordinate and as superior to have proper communication. So it can't be resolved. It can't be resolved on a higher level. Much better if you can communicate primarily on your superior if the problem arises within the unit. So if it is not resolved within the unit, then that's the time you go to the higher level of management, which is the top level or the middle level of management of your institution. So still considering yung line of communication and chain of command is still hierarchical. And the
Okay, thank you very much, Sir Melvin. The key words is accountability, coordination, as well as the chain of command. However, in the process po, there are instances that we are afraid, nurses are afraid, but here, I would like to share our practice here at SIMC. We have an incident reporting and learning system. It's a mandate for all the nurses here in the hospital to report specifically incidences on phlebitis, falls, high risk for falls, high risk for bed sores, patients with bed sores, without the fear or fear na they will be punished. But this is a part of the continuous quality improvement projects of the nursing services. That's a good thing. The hospital should have an institutional guideline regarding reporting of events that the staff is accountable together with his or her supervisor. So,
Ma'am, can I add to
any
that?
more questions, Ma'am Lily?
Yeah. Actually, in the implementation of the hospital information system, di ba in the manner of reporting to promote also yung data privacy for the anonymity of the one who's reporting, the code is only used by the employee. But still, kasi yung manner itself of yung confidence for them to report is parang it promotes determination for them to report kasi nga you are not identified, but if the supervisor had the access on it, then nakikita niya yung whole picture of the problem. So I think it could take also a column for action for action plan whenever there are reports that will arise, kasi doon din manage specifically yung quality eh. Kung maraming reports doon, then there must be an immediate action plan or immediate talaga action on it. So I think if your hospital is having this hospital information system or such a platform that are being used, then I think with the data privacy and with the manner of reporting, this is already embraced as a way of reporting. Thank you so much.
Thank you very much, Sir Melvin.
Go.
Okay, sir, thank you again for the answer. Another question is from Tommy J. Pailna. Chemo drug compounding ay hindi trabaho ng mga nurses. Trabaho ng mga pharmacy. May karapatan po ba na tumanggi since hindi saklaw ng aming job description?
Okay, Sir Melvin, you can, or
Okay.
here in the hospital, with regards to the SIMC, with regards to the chemo preparation and oncology unit, I believe the management is already doing its, tapos na po ang planning. There are nurses who will be sent to the oncology nursing course. And with regards to the preparation, I believe the management has already discussed about the preparation. Mayroon na po tayong darating na safety cabinet, and also the pharmacy together with the nursing services, magkakaroon po ng discussions regarding it. And syempre, it entails about safety. So, if based kung pwede bang tumanggi, but I believe the nurses are already, tawag dito, meron na pong isisend na nurse for the oncology. As of now, I believe it was parang hihintayin po natin yung safety cabinet before we proceed to the preparation of chemo drugs and chemo drug compounding. So any words, Sir Melvin?
Yeah. In the performance or discharge of performance, it's always bounded within the job description or duties and function. Actually, you have already answered yung perspective na if it is not within their job description, then there will be a way. Will there be a way for the nurses to be involved? So your answer is, yung key answer there is to involve the nurses when it comes to the training. So in this matter, this will also impose yung interdisciplinary collaboration or interprofessional collaboration, since we still do not have the clinical pharmacies in place in most of these areas. So this could be part of our professional development. So I think if nurses will be involved in this matter, and the institution is very much open for professional growth and development, this will also benefit the nurses, and such training outcomes can be shared, and at magbe-benefit din yung welfare ng mga patients. So I think this could be a good move for the administration. Thank you.
Thank you very much, sir. Indeed, the management is already doing its best to mag-start na po yata ang batch ng ating mga SIMC nurses who will undergo training on oncology. And as well as the pharmacy services din po, they are already planning. Actually, parating na po yung safety cabinet, and then the training of the clinical pharmacy will push what I mean the pharmacist. Okay. So any more questions, Ma'am Lily?
Ako na ang sasagot. Hello? Okay, any more questions po? Yes, Sir Tommy, planning. As nurses, we should engage in the planning, lalo-lalo na sa inyong mga onco nurses, para ma-identify natin kung ano yung applicable improved process sa compounding. Okay? Sir Tommy, are you okay? So any more questions po? Napaka-importante po talaga ang engagement and involvement ng every employees in the medication process po. So kanina po ang discussion ni Sir Melvin para magkaroon tayo ng magandang output on the medication process with, syempre kasama ang protection sa ating mga employees. So we should involve and engage. So may isa pa po. May isang question pa po. Another from Peter, Tom. The question is, one of the rights of medication administration is right medication. If the nurse performs a safety check and finds a medication is not indicated, he or she has every right to question the doctor's order.
I will answer the question po I will answer the question po of Sir Peter. It's not actually we refrain from using the word question. You always seek to validate for appropriateness. Kaya po narinig niyo po sa amin palagi, no, it will always be appropriateness, but not really questioning the doctor's order. You can ask appropriateness of the order. Dapat klaro sa'yo. The indication, si pharmacist na po ang makakapagsabi niyan. So, kailangan po ng clinical pharmacist talaga on the ward level to check for appropriateness, drug appropriateness. Ang tawag po doon ay drug appropriateness. So, do we have a right to quote question, no? A doctor's order? Actually, it's not really questioning. It's validating pa rin the order. We would want to have a clarification, not to question the doctor. So on the referral process, you don't tell the doctor, ay mali ka. Ay, ano tong order na to? Well, no, you don't tell that the physician, no? Talagang magbabanggaan kayo. You always start with good communication. So if kung sa end mo, hindi clear kung bakit in order ni physician yon yung isang particular medication. If you are, wait lang po Sir Peter, you have a follow-up question na ano. So when you have a drug na hindi mo masyado magets kung bakit prescribe, you want to ask for a clarification. Always start with good communication and you start with clarifying it. Doctor, I would just like to clarify your order regarding this particular medication for this drug. I would like to know if what is the drug for, ganyan. So, hanggang sumagot yung doctor until na masatisfy ka, di ba? But if the sabi, di ba may follow-up question? If the doctor still insists on administering, can the nurse go up the chain of command and speak to a higher level? Okay. Ganito. You need to na-validate nyo po ba na talagang wala siyang indication? Yun kasi yung magiging tanong. Patients' illnesses are very complex. They are very, very complex. And there might be medications that maybe multiple. Talagang lahat tayo dito biktima ng polypharmacy. Maraming pong gamot talaga na we might think na it might not be indicated for the patient. So you really need to verify first with the ordering physician kung sige go, may indication siya. Kung wala, doon ka lang magtatanong. Can the nurse go to the chain of command? If I were you, no. O di ba tama rin sister? No. Ganito kasi, you don't quote question you need to seek the clarification first until you get the answer. If yung answer niya, if the answer breaches patient safety, sige doon. If the medication would breach patient safety, medication safety, sige, report mo. You report it. But you don't go to the chain of command agad, no? Parang you must have a process on it. Ang hirap kasi mag-address ng it's not a prescriber error naman, no? Kaya po sobrang importante ng appropriateness. You need a pharmacist or your buddy or your partner. Dapat kaya po dito po pumapasok yung importance ng double checking. Kasi kung ikaw lang po magsasabi na wala siyang indication, hindi pwede yun. Dapat someone would also attest to it. That's kasi pag ina-accuse, parang the physician would feel accused na parang sinasabihan mo na o-order siya ng mali, di ba? We don't do that here. We just seek for clarifications regarding their order, but not kasi di ba sabi ko nga prescribing errors, it's not a lapse in judgment. Hindi po. It might be overlooking the process of the prescriber, the prescribing process itself. So, pwedeng hindi na-overlook nila yung dosing, na-overlook nila yung name ng medication. So there might be there, but it's not entirely a lapse in judgment. It's how you communicate. Tama si Ma'am Sherry no narinig nyo. It's how you communicate also that concern, di ba? If there is no indication, tell it to the physician. I am unsure of what the medication is for. Can you clarify? May I know what is the medication for? So ganon. You communicate your question very well. Kaya po dito importante talaga ang SBAR, and you really need to extend your patience kasi hindi po pwede yung parang pumintig yung tenga mo ganyan. Communication here is key. Wow, medyo intense yung tanong ni Sir Peter. So yun lang po.
Can I add on that very briefly? Okay. Kasi when it comes to the perspective of chain of command, if there are conflicts that is within your level, always involved kasi we involve yung on the leveling. Kasi for example, if your concerns when it comes to the care management related to medication, so probably you will consult your superior in the nursing service. primarily. You will not definitely proceed to the next level of the hierarchy ng mga physicians, because you will get cross on the principle of the proper coordination. So dun sa perspective na on the level management pa lang, so kung may healthcare team kayo within the unit, then if there is already a clinical pharmacist in place in your area, then yung explorative way of doing discussions for validations and verification, and to be evidence-based with our action, could be very helpful for all of us. So kung may ma-share yung perspective ng pharmacist, ma-share yung perspective ng doctor, at may ma-share yung perspective on the nurses, then di ba na-appreciate natin na holistic? We are bounded with one principle of patient safety when it comes to medication. So if it is not resolved within our level, conflicting yung mga principles natin and ideas, then that's the time, for example, that our superior, who is the charge nurse or the head nurse, may talk to the specific department who heads and under yung physician. If kung hindi it is not questioning their competencies. It is putting into the perspective that we are nurses who have independent clinical decision making, and at the same time, we are also part of the team as member when it comes to the patient's welfare. Thank you.
Last name.
So thank you very much for a very comprehensive and additional input for our response with regards to hierarchy of reporting. So I think that's the last question, Ma'am Che. So thank you for participating actively in our forum. Thank you very much.
So at this juncture, I would like to award the certificate of recognition to our 2 clinical pharmacists here in the institution at Southern Isabela Medical Center. So please, so certificate of appreciation is awarded to Dr. Stephen Ray G. Fontanilla and Dr. Athena Vernici Carlos for being the esteemed guest speakers with the topic on importance of validation, impact of patient safety, and monitoring in the medication use process during the Medication Safety Webinar Series held on September 14, 2022 as part of the institution's Patient Safety Week celebration with the theme, Medication Without Harm. Given this 14th day of September, year 2022, signed Dr. Luella M. Tan, Chairperson, Patient Safety Unit. Signed our CMPS, Dr. Butch Loreto O. Garcia III, and our ever-supportive MCC, Dr. Melchor C. De La Cruz Jr. At this juncture, may I now call on our ever-supportive CMPS, Dr. Butch Loreto O. Garcia, to give his closing remarks. Please don't leave yet. Magkakaroon pa po tayo ng batch picture taking.
Good afternoon, everybody. Would like to thank our 3 distinguished speakers, Mr. Melvin Miranda, Drs. Stephen Ray Fontanilla, and Athena Vernici Carlos for a highly informative and interesting lecture through our Medication Safety Webinar Series. I would like to thank also our Patient Safety Committee officers and organizers for the forum that just happened today, through our webinars series. Whatever you learned today, I hope that you practice it in your units as well as in your divisions that you represent. And try to make it as part of your daily work and life. Before I end, may I give you a quote coming from Mr. Peter Promovost. Medicine today invests heavily in information technology, yet the promised improvement in patient safety and productivity, frankly, have not been realized. I hope that you will become instruments for the realization of the accomplishment of our medication safety tenets. Again, to everybody, thank you and good afternoon.
Thank you very much, Dr. Butch Garcia. So for now, let's open our camera for our picture taking. Yes, please open your camera. Thank you very much, Sir Melvin. And to our Doc Ray and Doc Aquino, thank you very much po. Please open your camera. And to Ma'am Jen, Ma'am Cleo, Ma'am Delia, thank you very much po. To everyone here at SIMC, thank you very much for attending this webinar.
Mama. Ay.
Okay, please open your camera po. Maraming salamat po. So, to all,
Hello.
hello po. Nurses from QPMC, our nurses from CIMC, City Imulagan Medical Center, Ma'am Tina.
Sir Kenneth Abara, hello from CIMC.
Okay po. Yung iba. Sir Peter Tom, thank you po.
Sir Peter Tom, thank you for the questions. Ang hirap po ninyo magtanong, pero we hope you answered your questions.
Thank you po. And to our nursing supervisors, Ma'am Vilma Masa, thank you po. Thank you po.
Sir Kenneth, pakita ka naman.
Ma'am Malu, thank you. And to all our nurses here at SIMC, thank you po.
Tapos na ata.
And then to our dear doctors, thank you very much for attending this today's session. Kindly answer the evaluation. Those who completed this, the attendance and the evaluation will be given certificates via your email. Okay, okay na po ba yung mga pictures? So I can share now the video. Share. Nasaan na yun? SIMC, may share po ako. Ay, SIMC. Patient safe.
Ako na masisiguro ang kaligtasan ng pasyente. Ako ay nangangako na pauunlarin ko ang aking kaalaman at kasanayan upang magbigay ng mas ligtas na pangangalaga sa aking mga pasyente. Ako ay nangangako sa pagiging aktibo na makilahok sa aking sariling pangangalaga. Ako ay nangangako na bago ibigay ang gamot ay aalamin ko muna kung para saan ito. I-check kung tama ang pasyente, gamot, paraan ng pagbibigay o pag-inom, dosage at oras ng pagbibigay. Ako ay nangangako na magtatanong sa pasyente kung naiintindihan niya ang aking mga payo tungkol sa ligtas na paggamot. Nangangako kaming magtutulungan bilang isang koponan na bukas at malinaw. Nangangako akong ipaliwanag sa aking pasyente kung paano gamitin ng tama ang kanilang mga gamot. Nangangako akong susundin ang kinakailangang pamamaraan para sa bawat panganganak at operasyon ng aming pasyente. Nangangako akong ipagpapatuloy na bumuo ng mabuting pakikipag-ugnayan sa pagitan ng pamilya, ng pasyente, mga tagapag-alaga at mga profesional sa kalusugan. Nangangako ako na patuloy na mag-aalaga at magpapagaling ng may sakit batay sa ebidensya ng pananaliksik at siyensya. Nangangako ako na mapapanatili ang pagpapatuloy ng pangangalaga ng mga pasyente. Nangangako ako sa patuloy na pagtatag ng kultura ng kaligtasan ng pasyente. Nangangako kami sa pagtiyak ng kaligtasan ng bawat pasyente dito sa ospital. Makilahok, makiisa at magsalita, kaligtasan ng ating pasyente pahalagahan. Magkakasama tayong makakapagligtas ng mga buhay.
The link is already shared in the chat box for tomorrow's webinar. Thank you very much, everyone, and good afternoon.